I hereby call the August 25th, 2021 Brockton School Committee to order. It being time, if we could please stand and salute our American flag. I pledge allegiance to the flag of the
United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. If we could take a moment of silence for those lost in Haiti and those that are suffering, if we could do that at this time. Thank you. Thoughts and prayers are with them. We do have to establish a quorum. I'll just do a quick roll call vote. Mrs. Sullivan? Here. Mr. D'Agostino?
Here.
Mr. Minicello?
Yes, here.
Mrs. Mendez is not here. Mr. Rodriguez?
Here.
Ms. Azak is not here. Mr. Sullivan? Here. And the chair is here as well. We've established a quorum. We will now go into the agenda. Agenda number 2 is the hearing of visitors, and Melinda has confirmed that no hearing of visitors have signed in. So we will continue to move on. At this moment, I would like to welcome Sydney Marrow. Sydney is my new chief of staff. She's just an unbelievable individual, has a great professional development in higher ed, having worked at Bridgewater State for over a decade, Boston College for over a decade. She started yesterday, so we just wanted to welcome her. Thank you, Sydney. I am going to respectfully ask members of the committee if we could take Dr. Richard Herman out of order as we've done in the past, as Dr. Herman has to go to another matter as well tonight. So could I entertain a motion on that, please?
Motion to take item number, I apologize, under Teach and Learning, Dr. Richard Herman out of order. Second.
So motion on the floor made by Mr. D'Agostino, properly seconded by Mr. Sullivan. All in favor? All opposed? That motion carries. We will take Agenda 3C, the second matter under Learning and Teaching, Dr. Richard Herman, pandemic consultant, and he will give us a COVID-19 update. Thank you, Dr. Herman.
It's loaded on this computer. Want me to cue it up? Oh, Tracy can do that.
Thank you, Dr. Rick.
Thank you for inviting me back. My presentation today is only 300 slides, so it'll be a little shorter than usual. So it'll be a short one, exactly. You know, I was just, while we're waiting for that to come on, I was just saying that in 2009, when I was the chief of the emergency department at Good Samaritan, I was also in the role of chairman of the emergency management committee, the disaster committee. And at that time, we were planning for a pandemic flu, and it was really a real thing. And hospitals were asked to create a COOP plan, a continuity of operations plan, just in case we became overwhelmed with thousands of flu patients. And we needed to find an ACS, an alternative care site, to in case we had hundreds and thousands of flu patients. And so we went to a lot of nursing homes and other buildings around town, and the most welcome recipient of our actions in investigations was the principal of Brockton High School at the time when we met, and she was so gracious and gave us a tour of the high school and the cafeteria and the gym and places where we could put cots and house patients, and I was very impressed that the high school principal was so cooperative. And as am I equally impressed with the superintendent and the principal and the members of the school committee who have been very, very receptive to learning about COVID and being receptive to having kids get vaccinated.
Dr. Herman, who was that principal back in 2009?
But he didn't say that when I got back to my office. He said, "Oh God, please don't let them eat this. Please don't let them eat this."
Yep, so it was great. Well, when last we left off, I was last here a month or so ago, July 20th, things were looking pretty good. And this is the graph of where things were. There was a slight uptick in cases, but we didn't think much of it. And then what happened after that was, of course, the cases began to rise. And this is where we are now. The arrow shows where we left off. So now, and just to put it in perspective of an entire pandemic, you can see that our cases are now hovering in sort of about 20, mid-20s cases per day. Not as high, certainly, as we have been in the past, just a little bit shy of where we were during the spring. And in fact, the numbers, to my eye, look like they might in fact be leveling off. And this is something we thought hopefully could happen with the amount of folks being vaccinated, that things would not spike up really, really high to 100 cases a day, but might stay attenuated, stay low. And I'm hoping that we're as high as we're going to go right now. This is what the test positivity rate is. As you know, in the city of Brockton, anything below 4% kind of gets us back down into the yellow. And although the testing at Brockton Neighborhood Health Center is kind of in the 7% range, I understand from the data that when the numbers come out tomorrow, we're actually going to be just shy of 4%. So ironically, even though our numbers are high, we will go back into the yellow category just based on the number of test positivity. So it will be 3.9% or 3.86%, which ironically gets us back into yellow, at least for a week. And then we'll see what happens the following week. So this is what's happening in the hospitals because, of course, we need to keep an eye on our healthcare reserve. It's very important that we have places to go if we get sick. And this is what's happened to the hospitalization rate. It had been down to 0 patients, 0 COVID patients between the two hospitals. And now it's up into the low 20s. In fact, I think today is 19, if I remember. And anything over 17 represents 5% of the hospital beds. So we're just starting to nudge up over that area where we have to be concerned. The CDC would call that their yellow zone, not their red zone. The red zone is, as you see here, up over 15% of hospital beds. So we're not close yet, but obviously we want to keep a close eye on that. And we do every day. The hospitals give me the numbers of patients both in the regular medical floors and in the intensive care unit, and also tell me the amount of folks that are hospitalized that have been fully vaccinated. This is what the death toll looks like, and so, of course, we care about numbers that are hospitalized and numbers that have died. If COVID, as I've said before, were just a bad cold, nobody would care about it, but people get sick, people get put on a ventilator in the ICU, and people die. And so we've had 1 death per month over the last 3 months, and I'm hoping and praying that it stays low. Obviously, now that the cases have gone up and the hospitalizations have gone up, usually, as I've said before, this reflects itself in some additional deaths several weeks later. And so I'm hoping that it doesn't rise too high with the number of people that are in the hospital now. This is the metric that the CDC uses when they look at the transmission of COVID within the community. They measure a 7-day total and then average it out per 100,000. And anything over 100 patients over a 7-day total per 100,000 gets you in their high transmission. Between 50 and 100 is their substantial transmission. So we have been either substantial or high now for several weeks, closer to 200 patients in a 7-day period rather than 100 patients. So let there be no mistake about it. Brockton, and the city of Brockton, is a high transmission COVID area right now, according to the CDC. And this is tonight's dashboard. Those of you who follow the dashboard, today we're still in the red by virtue of having 27.8 patients per day. That's the red, yellow, green number that DPH looks at. 29 new cases reported today, 261 active cases, and we're going to stay, as I've said before, in the 200s of active cases for a while now until we get a handle on the current surge that's going on in Brockton. With 19 patients in the hospital. That box is yellow because anything over 17, which is 5% of the hospital beds, will turn it into the CDC yellow category. So we're yellow in terms of the hospitalizations. And in the middle is just what COVID looks like now in terms of a snapshot, a profile of the month of August, and what the case profile looks like in terms of age groups. So you can see it is a disease of younger age groups. Although, I must say, I have noticed a trend recently in that some of the older population, we are seeing some additional cases. So in the month of June and July, for example, we had, in the over 70 age group, we had 3 cases, 3 people over 70. In the month of August so far, we've had more than 30 cases over 70. So that's 10 times as many people in that age group already in the month of August, and the month is not over yet. A lot of this may represent breakthrough cases, so people that have, don't forget, this is the population that got their vaccines early on in the course of the pandemic, and now their immunity may be starting to wane. So a combination of waning immunity from their vaccine, as well as the high virulence of the Delta variant. So just something that we have to keep an eye on, and I'm sure this group is going to want to get their booster shots as soon as they're available to them. And this just tomorrow's number, when it comes out, will be 27.4. Usually I give this talk on a Tuesday, so being on a Wednesday, I feel much more confident predicting where we're going to be tomorrow because it's only another day's worth of data. So we'll be up a little bit of a tick tomorrow, and then hopefully, I'm hoping that things level off at that area. And I put it in yellow just because I think the test positivity rate is going to be just shy of 4%. This is what our neighbors were doing in the middle of the month last month when I was here, with overall a number of 1.2. And last week now they've gone up to 17.4. That's all comers in this population group, with a couple in the red, a couple in the yellow. And tomorrow I'm guessing it's going to sort of be kind of in the same neck of the woods. I don't think it's going to be too much different last week to this week. So when I was here last time, we used the CDC prediction model. This was in the middle of July, and they felt in Plymouth County, our numbers are going to go down. I did say in Brockton, though, usually doesn't reflect Plymouth County, might go up a little bit, but in general, they felt the numbers were going to go down. Of course, within a week, they published their, don't really believe these numbers because you got to take them all with a grain of salt. We got it wrong. And in fact, the numbers didn't go down. This is the new forecast. So this is this week's forecast showing over the next 4 weeks what they're predicting will happen in Plymouth County. They're feeling like the numbers will go up from where they are, meaning when school starts and during the month of September, we're expecting numbers, at least by the CDC, to be slightly higher than they are now. So if we are in a high transmission rate now, we're going to continue to be in a period of high transmission during the opening of school in September. What about the kids? So this is where we were in July 17th, a total of 1,800 plus kids between 0 and 18. This is where we are now as of yesterday, a total of over 2,000 children between the ages of 0 and 18 who have been infected with COVID. 1 more hospitalized, so 9 total. And I show you that as 0.4%. So of those 2,000 kids, 0.4% were hospitalized. With adults, it's usually closer to 4% or more that get hospitalized with COVID. So still, even though we're seeing more cases in kids because there are more cases, it does not tend to be serious illness yet, at least in the city of Brockton. And I know nationwide there's plenty of reports of pockets of kids being infected and pockets of kids being hospitalized, but it's not being reflected yet in the city of Brockton. And this just breaks it down by school-age kids, so you can kind of get an idea of the absolute numbers of preschool, grade school, elementary school, middle school, and high school age kids. So about over 600 high school age kids with confirmed or probable COVID. Confirmed, again, is a PCR test, a molecular test. Probable is a rapid antigen test, which now are awesomely good. It used to be not so awesomely good, but now kind of in the 98% sensitivity. And this is just breaking it on by age group. a little bit more. So you can see this kind of steady rise as you get older, with the exception of infants, the steady rise as you get older, and extending it out to up to age 22, you can see that the older you are, the more cases there are. This is what it's looked like by month to month. So we really did not have too many kids at the beginning of the pandemic, even though that's when we had the most cases, but we really didn't see the pediatric cases hitting until the winter time. And I'm expecting when schools open that we will continue to see increased cases. It needs to be expected that we are going to have kids getting together. There will be positive cases come September. Can talk about the Delta variant. The city does submit samples. Only a very, very small percentage, as I've said, gets submitted for sequencing, genetic sequencing, to determine what kind of variant it is. The Delta variant, as you have no doubt heard through any media outlet, is very, very contagious. Twice as many infections per person. Each infected person spreads twice as many as the original COVID virus. When I was here, that circled oval on the bottom is where we were. The orange bar represents the percentage of the variants that were Delta, and we saw that it was increasing, and now that's all you got. And this is the New England region, so it's only Delta. Virtually 100% of the variants are Delta. And we actually have measured it in Brockton. This is the data in Brockton. So since the beginning of the year, if we do a profile of the 3 major variants this month, all we have is Delta variant. There's no more Alpha, Beta, Gamma in Brockton. And let's talk a little bit about vaccines. So the big news this week is that the Pfizer vaccine no longer is emergency use authorization, which means that it has full approval of the FDA. And so I am hoping that this means that people will treat this as any other vaccine that has full approval of the FDA, and that employers will require their employees to be vaccinated, whether it's a small mom and pop shop or a major corporation like an airline, that universities that were on the fence about recommending whether their students should be full vaccinated will now require it, that municipalities that have the ability to do so will recommend that all their city workers be vaccinated, that school systems, whether on the local or state level, will require anyone who can get a vaccine and is eligible to get the vaccine. And I'm hoping that now that the FDA has given full approval, that there'll be a trend towards requiring vaccinations, just like we require vaccinations of measles, mumps, rubella, and other illnesses that we require to go to school, to travel to countries, to be in the military, et cetera. So we do know in Brockton, and I presented this to City Council, we do know by census tract what areas of the city have been vaccinated, and we do know by going door to door to 50,000 door knockings where people fall into one of these categories of already vaccinated or hesitant or whatnot, can actually break it down so we know who are strongly opposed, who are still looking for the vaccine. And so we're going to continue to do that and continue to make the vaccines available through all the various clinics that the city offers. This is where we are as of last Tuesday. These numbers will change tomorrow. So of the eligible population, so of the 82,000 people in Brockton who are eligible over age 12 or older, to get a vaccine, 58,000 have gotten at least one dose, which means about 70% plus of people have gotten at least one dose. Unfortunately, with the Delta variant, that ain't good enough. We have to look at the 57.3% that are fully vaccinated, because my new approach to this is either you're fully vaccinated or you're not. partially vaccinated doesn't get you there. It used to get you there for the original Delta strain. The original one dose of a vaccine got you pretty well protected. But for the Delta variant, not good. You really need to get both doses and pretty soon a third dose as well to be strongly protected against the Delta variant. And even then, I gotta say that we're seeing the studies now coming out where we're looking about vaccine efficacy in the age of the Delta variant. And we see it's not in the 90% anymore. That was in the old days where we had the original virus. But now in the age of Delta, we're seeing numbers that say 40%, 60%, 80%, depending on what study you're showing. Now this is protection against disease, okay, so turning positive. The vaccine is still very effective against serious illness, so hospitalization, or death. So just because it's not as great as it once was in terms of protecting 90% of the population from getting illness and turning positive, it's still very good at protecting against serious illness and death. And again, these are last week's numbers. Hopefully they'll go up a little bit. We like to get 1,000 new residents vaccinated each week. We got 750 last week. These are just some of the profiles of the age groups involved. I think we're doing really well in terms of our over 65, getting at least one dose of vaccine, but still I think can do better across all age groups, especially the younger folks and the kids. And just if you're, these are all the same graphics, just presented in a different way. If you're a visual kind of person, this is by vaccine age group. It's not by decade of life. Again, it's how the Department of Public Health breaks down the vaccine age groups. The blue bar is the number of residents in the city. The green bar is the number that have gotten at least one dose of a vaccine. And again, just to kind of show you the absolute numbers, under age 50, mediocre; over age 50, pretty good. So what about breakthrough cases? So breakthrough cases are cases who, someone who's been fully vaccinated, meaning they got their second shot and now 2 weeks have passed, so you're at least 14 days after your second shot, and you still turn positive. And some of those people have no symptoms whatsoever. Majority have mild symptoms and occasionally get serious symptoms. So this data from the state is very recent, from the state's lead epidemiologist as of yesterday. And in Massachusetts, of the 4.5 million people who have been vaccinated, there have been 15,000 breakthrough cases. Now 15,000, if you just said 15,000 cases, you have to say that's a lot of cases. But when you figure it's out of 4.5 million people that got vaccinated, there are the percentages there. So it's 0.3% that broke through, and of those, it's 0.01%, so 100th of a percent, who are hospitalized, and even fewer that have died. And there are the numbers for Brockton. So through August 24th, 142 breakthrough cases out of the 47,000 people, residents who are fully vaccinated. And so those are the percentages. So again, you can see that although we are seeing more than just a handful of breakthrough cases, still very good protection against hospitalization and death. So what are the authorities, the experts, saying about schools? Well, and as I said last time, the American Academy of Pediatrics, the leading professional organization of your kids, pediatricians, are saying, 1, schools should be in person. 2, everybody should be wearing a mask, students and staff, vaccinated or unvaccinated. And 3, if you are eligible to receive a vaccine, get a vaccine. So that is what the experts are saying. What is DESI saying? So DESI, as you know, has come up with some language this week. And so DESI, along with DPH, continue to strongly recommend that all faculty, staff, and eligible students receive the COVID vaccine. So from a public health perspective, personally, I think this is not strong enough. This is sort of like saying, You know, you're standing in the airplane, you're about to jump out, and there's a sign over the door that says, "Wearing your parachute is strongly recommended." It is not exactly the language we're looking for, or the astronaut in the airlock before he steps out to take his spacewalk. Wearing your spacesuit is strongly recommended. Or the pilot going through your checklist before your it makes no sense to me. If it's strongly recommended, then say get a vaccine. Recommend it. Make sure it's mandatory. But that's from a public health point of view. That is the most important tool that you have in the toolbox. So what have they recommended? Well, first of all, they are recommending masks for K through 12, anyone over 5 years old, for all students and staff in all the schools. And this will be in effect at least until October 1st. And October 1st, there's a reevaluation. So what happens on October 1st? On October 1st, there's an option to lift this as long as the building, not the entire district, but as long as the building has 80% fully vaccinated. So if one school has 80% of the students and staff fully vaccinated, then there can be a discussion regarding not wearing masks in those who are fully vaccinated. Of course, this then creates kind of a two-person society here. We got the vaxxed and the unvaxxed, and some people wearing masks and some not wearing masks. And I think if anything, I don't like that idea. I think everybody should be wearing masks, but if there's any positive to look at that, it might motivate some people to at least get vaccinated so they don't have to wear a mask when it comes time to remove the mask mandate. So part of DESI's plan is to have a testing program. I'm not going to go over this other than to say that Linda Cahill from the school nurses and the school system are working on establishing a testing program with CIC. CIC is the company that ran the big vaccination sites at Gillette Stadium and the Heinz, and they are going to take care of giving us a district manager and on-site people to do the testing and collect them and in the software programs and set up rapid antigen testing, the Binax now, rapid antigen testing, very highly sensitive, highly specific, will be on site for all the students. And there'll be symptomatic testing, so if you feel sick while you're in school, we'll be able to get a rapid test. There will be a new program called Test and Stay. This has been vetted in other school districts around the country, where if you are a close contact in school, rather than quarantining and sending you home for 7, 10, 14 days, you can now stay in school as long as you are tested daily for the next 7 days, a minimum of 5, because there'll be weekends in there where they won't test you, but where you test daily, and as long as you're negative, you can remain in school. This will not apply to students who are close contacts outside of the school. So if you're a close contact with a family member at home, you don't get to participate in Test and Stay. You have to go into quarantine at home. And then there'll be pooled testing. So pooled testing, I don't like that language, but it's basically taking a group of 10 people, 10 students or students and faculty, and putting them all in one swab. It saves the amount of testing that you have to do. If you all 10 are negative, that's great. If the test turns positive, then you have to drill down and find out who the culprit was to find out who the positive test was. But we will be doing all 3 of these in the city of Brockton come the start of the school year. And this is what CIC will be providing: a district level coordinator, specimen collectors, and a program coordinator to assist the school nurses in collecting testing and advising them and managing the information flow. So what do we have to decide to do? From my perspective as a public health advisor, I say you use every tool in the toolbox. We're in the middle of a global pandemic. If we have a tool and it works, use it. So the first tool that we have is vaccines. We know they work. They are fully approved by the FDA. And we need to do whatever we can do legally, morally, ethically to get as many kids and students, and faculty and staff to be vaccinated. This is the right thing to do, and it's the tool that is the most effective. All the other 7 that I'm going to list are way second best. This is the best. So we are going to be doing masking, and we already have a plan in place. I don't have to recommend anything. DESI is recommending universal masking for all students and staff, at least for the month of September. We also have the comprehensive testing and contact tracing program that will be contracted out through CIC, and this will enable us to know who is positive, who are close contacts, and manage the contact tracing as students and staff turn positive. We also should be working on whatever we're doing to improve ventilation in the schools, whether it's individual units in the classrooms, windows being opened in the classrooms and school buses, but ventilation management, we've learned, as this is an airborne illness, is very important to control the spread. Likewise, we have been talking recently about having some kind of capability for on-site vaccinations within the schools, and those discussions have just started with the superintendent and Linda Cahill to kind of figure out what we can offer kids on-site at school so that they don't have to deal with making an appointment and going somewhere. We'll bring the vaccine to you where you go to school, and hopefully we'll be able to implement that kind of program. And then ongoing education. This is so important because there's so much misinformation that's out there that it's very important to keep the dialogue ongoing, address people's concerns, because of those seven things that I've said there, there's probably half the population that disagrees with me on the importance of them, and I think we have to be able to continue to listen to people carefully, what their concerns are, and educate them as to what the science shows and what we're trying to accomplish. So that's what I got, and happy to take any questions.
As always, Dr. Herman, thank you. You always do a deep dive on the metrics, and we're very fortunate. Brockton Public Schools, City of Brockton, is very fortunate to have Dr. Rick Herman, and the Commonwealth has recognized his efforts. They've replicated in other municipalities as well. He was the creator of the dashboard, the daily dashboard, and it's hours and hours and hours of his time. Any questions of the school committee member for Dr. Herman? Vice Chairman D'Agostino, please.
Thank you, Mayor. Thank you, Dr. Herman, for joining us again. Again, you've been an invaluable partner through this pandemic for this committee, and to be able to work our way through the decisions we've had to make. I have two questions for you tonight. First off, I know that right now for students, it's currently, if I'm not mistaken, it's 12 and up that's able to get the vaccination. Is that still the number?
That's correct. The emergency use authorization is between the approval, the formal approval is still 16 and up. The 12 to 16-year-olds still are under the emergency use authorization. So the approval for full FDA approval came for 16 and up. But Pfizer is still approved has emergency use authorization for anyone 12 and up.
Okay. And have you heard anything as far as how the research is going with younger than 12, or is that not really happening at the moment?
Well, I know that the research is ongoing, that they're still trying to reach that target number. You know, they have to accrue a certain number of people that get the disease so that they can, once they hit that number, they can stop the study. So right now it's kind of good news, bad news. The bad news is you have to get a lot of sick kids in order to reach that number. The good news is Delta is here, and so they'll get to that number pretty quickly. And so, you know, I've heard everything from late September to not until this winter, but,
Right.
you know, I would say weeks to months is kind of the time frame.
Okay. I was just curious where that stood. My second question, I have heard from a few folks that have reached out, and I'm hoping you can kind of speak on this a little bit, that are comparing this to your typical seasonal flu. I know that you've heard this many, many times, and that's kind of what's out there a lot, is that, you know, some even are saying the flu is worse, which I don't happen to share that. But so can you kind of talk on that for a little bit for the folks that share that view?
You know, I don't have the data, but I can get it. I can tell you that I do lecture nationally on the flu. That's one of my other jobs before the COVID pandemic hit. And the numbers are not nearly as high. The amount of death and disability from the flu is not nearly as high as what we've seen from COVID. The one striking difference between the flu and COVID is that flu is a disease that has high risk in both extremes of age. So the very young and the very old are at high risk from flu. With COVID, we initially thought that the very young were not at high risk. And in fact, it's panning out that for the most part, it does not tend to be a highly serious illness in kids, although we certainly are seeing plenty of kids hospitalized and have seen deaths in kids. But I think the flu, as far as affecting kids, may be causing more serious illness. But as far as a community spread, it's important that kids are part of the community spread. So if you turn positive, then you're affecting the entire rest of the community, teachers, people staff at school, your family, everyone else. So they play a key role in spreading the disease, even though they may not have a key role in occupying hospital beds.
Right. Yeah, I mean, if you have the data or facts on that you can maybe, have sent to the committee, I think it would be helpful, at least for me, when you get those kinds of calls, to be able to have some actual factual information to say, well, here's the facts we got from the medical people,
Sure.
So that'd be great. Thank you.
Thank you. Mrs. Sullivan, please.
Yes, thank you, Dr. Herman. I just have, I agree with everything you said, but just for the masks, because I know you said recommend, but it does say required, and I think there's a real difference between recommend and required. So the masks are required for students to return to school and teachers. They're not recommended.
No, they are
then-
required.
Because then people will think
No.
it's,
Yeah, no. This
There's
is,
a choice where
it
there
will be,
isn't.
yeah, it will be required for all students, K through 12, in all schools, at least until October 1st.
Inside the building.
Sorry if I misspoke.
no, I was just wanting
Yeah.
it to be clear to parents that
Yeah.
it is required.
Yeah, that is a
inside the building.
statewide Department of Elementary and Secondary Education
Right,
edict.
until October 1st, or the vaccination rate goes up to 80%.
Right. I mean, it will be at least until October 1st, and then you can measure, and that's another hurdle we have to overcome. And I've spoken with DESI about this just to try and figure out how we are going to track students and staff and figure out, if they have been fully vaccinated.
Right, I just wanted it to be clear to parents because there's a lot of misinformation out there. Also, on the test positivity rate, we're at 4.75 right now.
Yeah, I think
Is that
tomorrow
next?
we'll be at 3.89 or something like that. It'll be
So
just
would
under
it-
4.
What do we have to be at to get back into yellow?
Under 4.
Oh, under
So,
4,
yeah,
okay.
so I think tomorrow we will actually go into the yellow, but I think it's somewhat misleading. The whole color coding is somewhat misleading because our numbers, the number of cases that we have is still the same. It's just that so much testing has been ongoing, especially with onboarding kids going back to school, going back to colleges. There's been a lot of testing done, and so the denominator gets bigger with a lot of people that have negative tests. So I'm not hopeful that that's going to stay that low for a long period of time. But I think tomorrow we'll get a reprieve, if that's called a reprieve. I think in a way it's a little misleading because everything's the same. We're still seeing mid-20s cases per day. It's just that the test positivity rate. That's why it's so important to look at more than one metric. You can't just look at test positivity rate. You've got to look at a whole bunch of metrics and put them all together, like cases per day and hospitalization rate, et cetera.
Okay, thank you very much.
Thank you, Mr. Sullivan. I'll do Mr. Sullivan, followed by Ms. Azak, please.
Thank you, Dr. Herman. Excellent presentation. I had a bunch of questions, but you answered them all. But I do have one on the booster shots. Do you have any inside information or a date when something is going to come out on all 3 of them?
On all 3?
Yeah, the booster shots.
Oh.
I heard Johnson & Johnson was talking today.
Yeah. So, and just to clarify, there's a little bit difference between the 3rd shot and the booster shot. So 3rd shots are available now. A 3rd shot is for people that are immunocompromised on cancer chemotherapy, transplant patients, people who really have a weak immune system. They can get their 3rd shot anytime 28 days after their 2nd shot. It's a little bit different than the booster shot, which is for the majority of the other 97% of the population. So someone who's been fully vaccinated has gotten their second Moderna or Pfizer. And I understand the recommendation, at least now, it's going to be 8 months after your second shot is when you'll be able to get your booster with Pfizer or Moderna. That may change, as more data comes out and they realize, well, maybe should be 5 months or 4 months or 6 months, so that could change. But right now, the current plan is 8 months with the starting gun going off on September 20th. So anyone who got their vaccine, in January, basically will start getting their booster shot in September. So just figure out when you got your second shot and add 8 months to that. As far as Johnson & Johnson, I do know there's information from the company that says that a booster shot boosts the neutralizing antibody, the amount of antibodies that you have, but I haven't seen any kind of formal recommendation yet from CDC on that.
Okay, thank you.
And I can tell you, sort of the 8-month rule won't apply for a while for J&J, just because we didn't start in Brockton giving Johnson & Johnson until March at least. So that would be November when the 8-month rule comes. But they may recommend something sooner.
Thank you, Mr. Sullivan. Ms. Azak, please.
Thank you, Dr. Herman, for the presentation. I do apologize. I was a few minutes late. It was move-in day at college. But I'm glad I was able to get here a little bit on time. So couple of questions. So I've had a lot of constituents reach out. So I know a lot of families are actually comfortable with us going back, even though it is required. They're very comfortable with the masks. I didn't, honestly, I really haven't had any families reach out and say, no, we don't want to wear masks. So this is a positive. But I do have a quick question. Within the past 2.5, maybe 3 weeks, the number of people that I have heard that have been vaccinated and have actually tested positive for COVID it doesn't make sense. So is the Delta variant, I know it's in Brockton, does it move a lot faster? Because usually it's 3 to 5 days for it to incubate in the body before somebody tests positive. Is the Delta variant moving a lot faster than that?
I don't know the clinical. I mean, I feel like the clinical picture is about the same. So anywhere between 2 and 14 days after exposure, you can test positive, and usually symptom onset is about 5 days afterwards. Whether it's a few days quicker because there's a higher viral load with Delta, it's possible. I don't know if the study. I'm not familiar with that study, but I think we are going to see. We've got a lot of people in Brockton that only got 1 dose and did not get the second dose. They are still vulnerable, and the one misconception that I do want to clear up is a lot of people feel like they missed their chance for their second dose. Their 21 days or their 28 days kind of came up. They missed that for some reason, and now they feel they're not eligible. If there is anyone who missed their second dose, just get it now. It's never too late. Get the second dose. It will boost your antibodies. There's not the study that's going to tell you, well, if you get it at 2 months or 3 months or 4 months, how much it's going to boost your antibody, but it definitely will. So people should get that second shot. And we are going to see these breakthrough cases, no doubt about it.
So between 2 to 14 days. So what I usually, I've been telling people, they'll go get tested and they'll come back, oh, it's negative. I said, well, you know what? It's not going to hurt to get tested in a few days, because you might have just gotten a false negative. So is it a recommendation that people just get tested now on a regular basis, especially if you're out with the public I mean, for what I do for work, I'm out with the public. So I do get tested on a normal basis, probably bi-weekly, just to keep everybody safe and keep my family safe.
Yeah. So in general, there's lots of different testing strategies that are out there. But one that seems to be pretty well adopted is if you feel you've been exposed, then you should self-quarantine, not expose yourself to anyone else, and then on day 5 get tested, because by then it's likely that you're going to get positive. Some people do it on day 3, some people wait till day 5, but you're not going to turn positive in the first. If you get exposed today, there's no sense in getting tested tomorrow. It's just not going to turn positive. You know, you do
Okay.
have to wait a few days. And during that interval, you should be quarantined.
Okay, no, definitely. I actually got a chance tonight to see a different type of the swab test. Usually we see the Q-tip, and my niece actually at college now has to weekly, and it was like a plastic. It looked like a Q-tip, but it was plastic with no cotton on the top, and it was different. So there's different types of tests that are out there. That was the first time I saw that one, and it was uncomfortable because I could tell from her face. But it's nice if we can get testing and get people comfortable with getting tested. It's free for many, as long as it's not the rapid one. And I know I just went to Massasoit, and it was 15 minutes in and out. Neighborhood health, I mean, they're pretty quick nowadays.
Yeah, and we do have 6-day-a-week testing at Massasoit, I think Monday, Wednesday, and Friday. I don't want to say the hours, but 3 days a week is the morning, 3 days a week is in the evening hours, so it's available. Testing's available at Brockton Neighborhood Health Center, and we're talking about setting up the testing trailers again at Campanelli.
No, thank you. Thank you so much.
Thank you, Ms. Azak. Any other questions, Mr. Minicello?
Thank you again, Doctor, for coming in. With respect to the people the 3 deaths, were there any factors or risk factors that you have with regard to data that you could share regarding the circumstances surrounding them in terms of age or vulnerabilities?
Risk factors for?
That made those 3 people vulnerable to pass away, unfortunately.
Risk factors for COVID?
Yes. Were they older? Were they younger? Were they ill? Were they?
I see the people that have died. What the profile of the people that have.
Yeah, there was one per month for.
I see. Yeah. Well, of those people, they were older. There weren't any younger people that passed away. I know. I didn't look at this very last case in August. I have a little bit. I don't want to talk about any individual case just because there's so few of them. I think it kind of, when it's only a 1 or 2 persons, I think they become easily identifiable. So let me just say, in general, yes, underlying illnesses, especially respiratory illnesses and chronic conditions, put you at risk, and certainly older age groups still is at risk of dying. But right now, we're mainly in the hospital. Mainly. I'm not saying all of them. Mainly, it seems to be still a disease, a pandemic of the unvaccinated, at least in the hospital. So the majority of cases in the hospital are unvaccinated. There are some that are vaccinated, but the majority are unvaccinated.
And this new variation that's hitting the city, could you just describe what makes it more dangerous? I guess what makes it more powerful, or
Well, there's been I don't know the exact molecular structure that makes it, but believe me, they know the molecular structure. You can look and you can see every molecule on this thing and how it looks different than the original native strain of COVID. But clearly, the underlying mechanism is the amount of viral load. It just creates so much more virus in your nasal mucosa, up in your nose, where you're spreading this stuff around, that because there's so much more virus, it just creates more opportunity. And that the reproductive value, the amount of people that you are going to infect, whereas with the original version was closer to, let's say, 2 people you would infect with the original version. With the new Delta variant, it's closer to 7 people, and I've heard 5 to 9, but sort of 7 people that you're going to infect. It's just so highly contagious. That's why it's spreading so rapidly.
and by being vaccinated, it builds up a person's ability to fight this off, or at least to lessen the severity that it initially could cause if you weren't vaccinated, and be able to
So
fight it off. And
by being fully vaccinated, so 2 doses, clearly it offers some high level of protection against serious illness and death, and probably offers the ability to attenuate or lower the severity of the symptoms, even if you do test positive.
Now, every time you say 2 doses, I kind of like cringe inside, because you know, we followed the instructions, you know, get whatever vaccine you could get scheduled for, and I got the J&J. That's the one that I sort of just pulled, you know. I went for the date that I could get in, and that's what I got. So the J&J, you know, it's one vaccination. I was jumping for joy, one and done, thinking this is a great thing. But, I mean, could you sort of give us a little more information?
Yeah, I think as much as we can jump for joy during a pandemic, you know, and I had this very conversation with the state lead epidemiologist yesterday regarding, you know, sort of trying to do the deep dive, what vaccine is best. And the bottom line is all three are very effective. So it's, you know, it depends on what study you look at, and you're kind of splitting hairs when you look at kind of percentages, but all three, and when you look at the profile, as I have done, breaking down the breakthrough infections in Brockton, the profile of those cases sort of kind of mirrors the profile of the vaccines that we've been administering. So most of them are Pfizer because most of the vaccine we've given is Pfizer. You know, a chunk are Moderna because a chunk has been Moderna, and a very few have been J&J because a very few got J&J. So it's kind of that same profile.
It's funny, my household is a flavor of everyone has a different one. It's so bizarre. But, well, thank you. I mean, you know, so people who did get the one vaccine just basically sit tight, wait for the information to come, and then just sort of follow the instructions that make sense.
Yeah, if you've gotten one vaccine, get your second dose. You know, you definitely should get your second dose. And then I think there'll be a lot more details to come about the timing of the booster shots and whether you can mix and match boosters if you got Pfizer but only Moderna is available, that kind of thing. So more to come on that.
It's indisputable that basically getting the vaccine is going to benefit you to fight off the resistance.
Yeah, I think it's very difficult at this point to dispute the data. The data is so widespread and out there that, you know, whether you look at neutralizing antibodies, real-world experience, hospitalizations, death, the vaccines work. I think it's very, very difficult to come with the science that's going to dispute that.
Well, thank you again. You've been very helpful to this committee because, you know, we're not experts, and we're just trying to do our best to guide our parents, you know, and our students and our staff and faculty, because this is, you know, something obviously that isn't in our wheelhouse, but we rely on experts like yourself. So we very much appreciate every time you come in here. You're a big fan with the people at home, I can tell you that. So thank you as usual, Doctor.
Thank you, Mr. Minicello. Any other questions? Anybody? Dr. Herman, on behalf of the school committee and BPS, thank you for what you do every day.
Thank you all. Thanks for your listening. Thanks for your attention.
Thank you.
Thank you.
Members of the committee, I'm going to ask if we could take a motion to take the matter right before Dr. Herman on the agenda, DESI fall opening guidance. I think it would just make sense to take that now as well, since it just piggybacks on what Dr. Herman was just talking about. I entertain a motion.
Motion to move DESI fall opening guidance.
It's a motion made by Mr. Sullivan. Is there a second?
Second.
Second made by Mr. Minicello. All in favor, please raise your hand. All opposed, please raise your hand. It carries. It's under Agenda Item 3, Report of the Superintendent of Schools. It is C, Learning and Teaching, subsection 1, DESI Fall Opening Guidance. Mr. Superintendent.
Thank you, Mr. Mayor. So thank you again, Dr. Herman. So today, the official letter came out, and that's in front of you, from the Department of Education requiring the letter that explains the mask requirement, dated today, yesterday, August 24th, at the Board of Elementary and Secondary Education. They voted to put this mask mandate in, effective immediately, for public school students ages 5 and above, and staff in all grades are required to wear masks indoors in schools, except for noted below, which is for medical reasons, where a student or staff member could not wear a mask. So masks are not required when the students or staff are outdoors, and then any visitors to schools are expected to wear a mask when they're inside the building. So that is the requirement from the Department of Education, which obviously we'll follow up until October 1st, unless then obviously we would talk if one of our schools, and again, it would have to be a school, like the doctor said. So a school, the entire student body and the entire staff at the school would have to be at an 80% vaccine rate for that school to be, or for the people in that school to be able to not wear a mask. And anybody unvaccinated, the 20% would have to wear a mask, and that would go into effect October 1st. So that is the mask requirement that came out from the Department of Education today, that obviously we will follow. And I'm sure that as we go through the opening of school, which is September 2nd, next Thursday, the Department of Ed and Commissioner O'Reilly will provide us with updates as we move through the fall. But the good news is we are coming back to school, full 5 days, all students, full in person, which is desperately needed for our kids and their families. And our staff is excited. We're getting ready for it. Teachers return in a week. Students return a week and a day, next Thursday the 2nd. So we are very excited to have students back full-time, 5 days a week. It's desperately needed, desperately wanted, and it's much better it's been a much better summer compared to last year, as we had to come up with 3 different plans: a fully remote plan, a hybrid plan, and then fully in person. So we worked all summer to do that. This year we knew back in, when we closed back in June, that we were coming back full in person. And the only thing that was really up in the air was this mask mandate. So now that that's out of the way, we know that everybody would be wearing a mask when we start. We still have masks left over from last year, and we ordered more. So all students and staff will be given school-issued masks with our logo, which we did last year. And again, this year, we have plenty of paper masks as backups. Every classroom still has their working air purifiers. Every classroom, every cafeteria, every gymnasium, every office has an air purifier. Students are required to wear masks on the buses and vans, and windows should be open. And again, we're ready to go. So we can take any questions on the mask requirement, but we're pretty much, the committee does not need to vote on that because it is now a mandate by the Department of Education.
Great. Ms. Asak?
Just a quick question.
Sure.
So for a little bit of clarification, because I know we addressed this a few months ago when we were discussing going back to school. So page number 2, 4th bullet down, says that the students, masks should be provided by the student/family, but disposable masks should be made available by the school for students who need them. I know we discussed it, because sometimes I've seen students, just out and about, they have the T-shirt material. That's not even the proper mask. So, are we going to try to push to make sure that they wear the masks that we're providing them at the schools?
Yeah, I mean, last year, I just going back to last year, in this summer, students were required to wear masks this summer in all of our summer programs, which, as you know, this summer we had over 4,000 students participating in our summer programs, and the kids have been great with their masks. And if a staff member, if there was a mask that was, very thin, it did not really meet the
bandana
requirement,
material,
then
T-shirt material.
we would make sure that they got the proper mask, either the one with our logo on it. And again, we have thousands and thousands of paper masks that we're able to give them. And when people visit the buildings, we do the same thing. So, yeah, we will definitely monitor that.
Definitely. You had already addressed it before I asked the question, but I just wanted the families to know that they don't need to go out and purchase masks. We have masks at the schools, we have the paper masks, and we also have the cloth masks with the different school logos on them. So I know I'm going to probably get calls like, oh, we need to go out and buy masks. No. We'll provide it, and actually we probably feel better if they use the masks that we have. At least we know they're thicker cloth material, and then we have the paper masks. But no, thank you. And thank you again. I know a few months back, you and our Chief Financial Officer, Aldo Petronio, got the air purifiers. We were ahead of the game compared to other districts. So, fingers crossed, everyone's excited to be able to go back to school next week. And this is definitely a lot different than it was 2020. So, I think if we follow the requirements, we should be okay.
Absolutely.
But thank you.
Great. I have one question myself. Just to confirm, Do we have any school that we know that is over that 80% threshold at this point?
No, we would have to, we'll have to spend the month of September looking
Figuring
into
that
that,
out. Right.
asking people to verify the vaccine, obviously the record of the vaccine. So, and we have the month of September to do that because obviously it's mandated
Right.
through until October 1st. So the exception for the 80% doesn't go into effect until October 1st. So that would give us the month of September to review that and find out that information. And then we would also, we talked today with the mayor, Dr. Herman, Linda Cahill, we were on a meeting, and we were talking about providing vaccines at every school, during the day, obviously with parent consent, and we would each, would try to get every week. You could get the vaccine, like say if you go to the Baker School on, I'll use a middle school because it's, just because it's not that young yet. So say it's East Middle School, every Monday, the mobile unit, vaccine unit would be at East every Monday, and, students, staff, parents could get the vaccine that day, and then depending on what they get, 3 weeks or 4 weeks later, they could, that another
Right.
Monday, they could get the vaccine at East, and then we would do that at every school. So we're talking about that now.
Right.
Just
All right.
again, to keep the vaccines
Yeah.
available to make them convenient, and, that would be something, and again, it's always with the consent of the parent, obviously, but that's number one.
Yeah, I mean, I figured we wouldn't know at this point, but I just wanted to,
Yeah, that's a good question, though. I appreciate it.
confirm and in case anybody, brought it up. Okay.
Yep.
Anybody else have any questions or comment on this? Mr.
I
Minicello?
think just basically by, following the age requirements, our elementary schools are not going to be eligible since, the students are under 12,
Yeah.
most of them, so you can take them right off the table right now.
Yep.
I mean, so, and depending, obviously, the middle, it'll be the middle schools and up, I would imagine, because
Absolutely.
the student body is.
And I mean, just going over this, when they announced it would be, students, the first guidance was, pre-K to 5, students would have to, basically, actually, they said pre-K to 6, students would be, required to wear masks, or strongly recommended. And that would have been difficult for our middle schools, because, we have middle schools that are obviously 6th, 7th, and 8th. And you have 6th graders, who most of our 6th graders are 11. And you would have had, a lot of students in the school that were not able to get vaccinated would have to wear a mask, and students who are already vaccinated would be wearing the mask. And obviously, the number one thing throughout this pandemic is we protect the social, emotional well-being of students. And it would have been very difficult for some students at that age level to be walking around wearing a mask, and some of their friends walking around without a mask. And there's issues that we would be dealing with peer pressure and those kind of things. So, I am glad that the state made this recommendation and mandate, because I think it really saved a lot of our kids going through very difficult times socially and emotionally.
All right. Any other question, comment?
Thank you, Mr. Vice Chairman. Got to refresh my memory, what matter we on right now?
The opening guidance, and we kind of had the discussion
Yeah,
of the mask mandate with that.
Yep.
So I think we're good with that one. We can go to the grand piano.
Yeah, that's nice.
Well, let's do the consent agenda. We
Oh,
haven't
I'm
done the
sorry.
consent agenda. We'll go back if we could.
I'm excited about the
Yeah,
piano,
I know,
'cause
well,
I am a big Liberace
You gonna play for us,
fan,
Mike?
So I'm a big Liberace fan. I wanted to get to the piano donation, but I'll wait
Well,
for the
we'll go-
consent agenda to.
I want to see you twinkle the ivories. Can you do it?
I know. Do you
No?
play? Let's-
Consent agenda, we have A, B, C, D, E. Is there any matters that need to be taken out, or are we going to take them collectively tonight?
Motion to approve consent agenda.
Second.
Motion was made by Mr. Minicello, was properly seconded by Mr. D'Agostino to accept the consent agenda. Any questions on that motion? All in favor? please raise your hand. All opposed, raise your hand. It passes. Just for the minutes to reflect it, A is the approval of the August 10, 2021 Special School Committee meeting minutes. B is the approval of July 20th, 2021 regular school committee meeting minutes. C, acceptance of notifications of personnel appointments, certified personnel. D is the acceptance of notifications of personnel appointments, non-certified personnel. And E is the acceptance of notifications of personnel actions, leaves of absences, resignations, and retirements. We will now go on to Agenda 3 again, which is the report of Superintendent Mike Thomas.
Thank you, Mr. Mayor. So we'll start with the donation to the Brockton Public Schools and the music department. That now we have the addition of a baby grand piano that was donated by Robin and Andrew Daniels, a family of Plymouth. This is a great addition to our music department for all students. This piano was beloved by the family, and it was played by Robin's late father, who was a well-known concert pianist. It will be moved into the Brockton High quorum in September, and the family will receive a thank you letter on behalf of myself and the school committee. So we want to kindly accept this and gratefully accept this donation tonight from Robin and Andrew Daniels, and we really appreciate. These pianos are worth a lot of money, and it's a very kind donation to our music department.
Very generous. Very, very generous, and we appreciate that. That kindness is greatly appreciated and going to help generations of kids here in BPS. Is there a motion to accept that gift?
Motion to accept.
Motion made by Mr. Minicello. Is there a second? Made by Ms. Azak. All in favor, please raise your hand. All opposed, raise your hand. It passes unanimous. We're very thankful for that. Mr. Superintendent.
Thank you. So next, we're going to welcome our new interim deputy superintendent of schools, who is an old friend, a long time, over 40 years of Brockton, not only a Brockton resident, a Brockton High graduate, and she was actually the graduate of the first graduating class of the new high school, 1971, where we just celebrated the 50th year of that. Yes. So Dr. Susan Zackwitz has returned to spend this year as the interim deputy superintendent of schools. I talked to Dr. Zackwitz back in June, and I'm sorry, where are we? No, it was July, and we talked about her coming up from Florida and relocating, and at first I'm glad she didn't hang up on me, and but she has accepted, and she started with us yesterday. So we're going to do a presentation, and then Dr. Zach will come up. But first, I want to welcome Sue with us today.
I do have to say, though, after listening to the doctor, I was living in Florida. I'm much safer here. I'm feeling healthier. They don't believe in any of this in Florida, so I was very encouraged. This was good.
Okay, just do Wenta, right?
No,
I'll do that. You can do it for me. I always shut it off. So we're going to go through. This was much longer.
It's not going.
Uh-oh. Tracy, you might want to help us.
It's not going. We checked it out beforehand, too.
You can just take it out and put it back in.
Say that again?
Take it out and put it back in the little.
Oh, did you take it out? No?
You want to take it and put it back in? And here. Point towards that back.
I shouldn't have to.
Usually you do it from
No, I do it from, I use this when I'm presenting. Oh, for God's sake. We tested it.
I'm gonna just click it here.
Oh, boy.
All right, so, okay, just pay attention to the.
Oh, this.
Let's go.
Oh, no, we're all
Good
set.
work.
Thanks.
Okay. All right, well, let's go back. Oh, no, I better not go back.
No, please.
Now going forward, I better not go back.
No, don't go back. All right, so, we spent some time with, we met with our principals and associate principals yesterday just to get us ready to get kicked off for an executive team for the school year. And, we obviously have been using the district review as far as when we're looking at instruction and academic achievement. So obviously we spent time talking about another point in the district review that really hit us hard is that since our previous height nearly a decade ago as recognized leader in closing the achievement gap, we have experienced a continued decline in academic outcomes.
You have to click.
Oh, I do.
There we go. Oh, no, you clicked too much. Go back this way. Whoops.
All right, sorry.
We got it. No, it's. no worries.
And then another thing that hit us is a line where it says, seems to be a little urgency or awareness in the district about the continued decline in student achievement. So, you know, one thing about Brockton, and it was a good thing to read, is that how the school committee, the staff, all staff, teachers, and all of our support staff, how much we care about each other and care about the kids. And that's undisputed. But we didn't have much of a sense of urgency of the decline that we've seen in student achievement. And we can change this, we have to change this, and that's kind of our motto going forward. So my previous message when I became superintendent 2 years ago was, and it still hangs at the central administration, and you see it around at a lot of schools, is work hard and be nice. Very simple saying. It's good and it's important, but it's not enough. We need to focus on when we know works, what research indicates, and what the data informs us of. So we've decided on 3 focus areas this year. And this, I apologize in advance, but you're going to hear this at every meeting. It's going to be on every agenda that goes out in the district, not only from me, but in central administration, but from principals as well. We're going to focus on effective instruction. 2, we're going to focus on active reading and writing. And 3, we're going to focus on positive relationships. Those will be the 3 main focus areas this year. And again, you will hear these over and over again. And just going over these, we have a lot of new curriculum. Again, thanks to you and how much you've supported that. Thanks to the Office of Teaching and Learning, who have spent a lot of time selecting curriculum and working with our staff and our teachers for spending time with this curriculum. And it's important to have quality resources, but that doesn't change the focus areas. It's how you use that curriculum and how you focus on it. So the focus areas demand students be challenged with rigorous course, high-level work. It's okay if they struggle. Again, like we said before, we love our kids. Our staff love our kids. This is the way we do things. We love our kids. But it's okay to see them struggle. That means they're learning, they're achieving. It's hard. And what's the movie, I think Tom Hanks, and it's the hard that makes it great. And, you know, it's the hard that helps kids achieve. So we have to continue to push them. And when, you know, kids are struggling, we have to let them struggle a bit, and then we have to support them, and that's how they learn. So we all need to come together. That's everyone in the school district, no matter what position they hold, to improve student achievement. Everyone must play a role in this process. It's all about the systems. And again, you see the little, we can't become a district where, you know, I'm sure glad the whole isn't on our end of the boat, because again, we have 11 schools in turnaround. And the schools who are not turnaround are close to turnaround. So this is kind of, you know, a picture of that, you know, just because your school's not in turnaround, we all have to be doing this. So that brings us to Sue. And again, Sue, longtime educator in Brockton. How many, 41? 40 years. And 10 years as the principal of Brockton High School. And I worked for Sue from 2001 to 2010, where a lot of this turnaround work happened, and it was all about focus, keeping the school focused. In again, it wasn't this long plan. It was 3 focused areas that we continued to push, and that's what we're actually coming back to, and I'll leave it to Sue from here.
Thank you, Mike. And it's a pleasure to be here, although I'm not sure I'll say that in January when I have to scrape snow off my car, as I've been living in Florida. But I did not laugh at Mike, and I did take his call because my heart has always been here. And you know, I've worked with so many of you, and I have to say, as probably for you too, when I read that district review, and there might be things you disagree with and challenge, but overall it broke my heart. And none of us want that. And so, and it was something that when Mike called and he talked about what he wanted to focus on, it's exactly what we did before. And those 3 focus areas are about what kids need, not just in school, but in their lives beyond school. So I'm, by the way, grateful to this committee because in my time in 10 years as principal, I went through 4 superintendents. So it was always a challenge and also some bad budget times. So the curriculum that you have in place now, thank you. But as Mike said very well, that's stuff. Now it has to come to life, and that's what happens with effective instruction, a focus on active reading and writing, and of course the positive relationships, which came across clearly. So my job will be to get those, and I believe in that. So here I am, and I'm happy to help in whatever way I can. And what I will be doing heavily is working with the principals, because I said that, and we're going to show you, I'm going to go through it more quickly, but we felt it was important for you as the guiding body of the school system to know, so that when you're talking to principals, teachers, you need to know what we're saying, so that, because I feel, I'm listening to this and what you've had to deal with for the past year, COVID, and it's all, this is about what you really probably joined the school committee for, which was to talk about education. So we want you to know and to be able to ask us, so when you go to the schools, you're asking the same questions. Because we fully well know you're going to get information from whomever you speak to, but these 3 priorities are the priorities of everybody. And as Mike said, it's going to be, we've already met with the principals. You'll see what we did with them. Tomorrow we're meeting with all the other administrators. And so we're going to show you that. Anyone that wants to go over this in any more depth, we're happy to. I'll go through it quickly, so just that you get the picture of what we already did with the principals to kick off the year, if that makes sense. And I will be now their immediate supervisor. It's been, because this district has had to pull apart for budget cuts, people have assumed other responsibilities because they're good people and you want to make things work. But this way, the principals will be reporting to me. It'll be systematic. We're taking a look at the whole organizational chart. We'll need input from it's going to be, it'll be step by step. But the first step really needs to be in the buildings and what happens, because that is really where it all takes place. It's sort of like if any of you saw Hamilton, you want to be in the room where it happens. That's where it happens. So also coming to help us was my first associate principal, Maria Lafort, who's going to be doing some work on writing and reading in the school sites. And by the way, nobody does it better than Maria. So anyway, I'm going to just zip through this because you don't need to see our So why did Mike get back in touch with us? And you know this. Some of you were here, some of you weren't. Some of you, were, well, I probably am the oldest person here, but that's beside the fact. But many of you were here when we were on the front page of the Globe as one of the worst performing schools in the state of Massachusetts under the headline Failing Schools. And after some hard work around literacy, reading, writing, we ended up back on the front page of the Globe as the turnaround story in Massachusetts. And then we even ended up on the front page of the New York Times. So we know how to do this, and we can, and we will. And so there's just no doubt about it. So how did we do it? And this is what we went through with the principals. It starts off with a team. That's already here in place. Everybody has that team. But now we need to get it working on a focus on literacy. But particularly, we're narrowing that. Let's take small steps and do them well. Active reading and writing. We implemented with a plan. We didn't just say go forth and write. We did it with a plan. And something that's been not, I think, attended to enough, we monitored it like crazy. And the people that were in the school will laugh because I said this, I know there's certain things like all of you parents, you say the same things over and over again. What gets monitored is what gets done. And so all of that takes leadership, and that's what led to the principles. So, and for you, this is just my own non-research based 40 years in the business definition of leadership. I know there's really lofty definitions that, researchers give. This is to me what all of you do. And you're trying to do it now, by the way, with COVID and convincing people. Leadership is getting people to do what they need to do. But for some reason, they can't or they won't. The can't is easy. Not easy, easier. You teach them how. The won't is a tougher battle, and you probably have plenty of those won't experiences, but you do the best. And so it all happens in the buildings. The principal's leadership, and I actually joked about this, but it wasn't a joke. It was the truth. I said to the executive team, block your ears, because I'm going to say something. There is no member of any central office team that can do what happens in the building. The principals need to lead this effort because they are with their teachers and with their kids. And that's where it happens. And the research overwhelmingly supports it. There's never found a school with achieved anything significant without a good leader. And John Safier, who is an amazing researcher and leader in education, good leaders grow schools where the organizational culture is energized, collaborative, and results-focused, so the teaching and learning in all classrooms are always getting better. And that's what we've got to strive for. And now, especially, by the way, because we all know that the gaps, we already had an achievement gap. It is exacerbated after this past year. So that's why this focus is essential. And we talked to the principals about how much they make a difference in student achievement. Everybody always, the teachers make the greatest difference. Teachers account for 33% growth, but a good principal adds 25% of student performance gains. That's powerful work. And accounting for 2 to 7 months of added learning, increasing students' percentage by 10 points in just 1 year. So it's powerful building leadership. Now, is this in the packet, Melinda, by the way, the article? Did this go in the packet for the school committee? Oh, I'm sorry, Friday. Okay, you're going to get this article. In New Bedford, Pia Durkin was the superintendent, and she was with New Bedford in the same position that Brockton is in now, in a partnership with DESI, in a precipitous situation, saying you need to move forward. And she wrote an article that I thought was very tight and concise, so we're going to share that with you. And she highlights the five big turnaround practices that they used. Now, I used only number 2 with the principals, but you're going to see all 5, and it's things that we should be doing always. Some we already do. But her invest was in principals heavily to strengthen their leadership capacity. And you can see what she said. The right work is less about a single leader, more about building the capacity of principals and their teams to help them become better at what they do. So what happens in Brockton depends on everyone here, and the principals are the key, but it's leadership at the building level. I want to share this with you because you are the sort of overarching leaders of this district. And one of the things that research is powerful on in education is that the nature of change is really horizontal change versus vertical. Now, I'm not going to get deep. This is how simple this is. Ed reform has been too horizontal, meaning we in education, not just in Brockton, this is across the board, we keep jumping from one initiative to the other, right? So, we say, okay, we're going to do this. It's supported and then implemented, and then there's a problem, so there's some pushback, and then, all right, then we better move to a new one. So what happens, we're always working on the next new thing, and what we refer to it as chasing the one shiny object to the next shiny object. There's no shiny object in effective instruction, active reading and writing, and positive relationships. So what you see is this, right? You're jumping from one thing to the next to the next. So what we call that is success by chance. And you probably know this because many of you are parents with children in the district. Even when I was a kid growing up in Brockton, going to the Brockton public schools, what did the quality of my education depend on? Who I was lucky enough to get as a teacher. So if I got Mrs. LaForte as a teacher, I'm going to learn to write. If I get somebody that doesn't know or presents worksheets all the time, your child isn't getting that. So we need to get it from not lucky enough, but success by design. Well, and that's supported by research, by the way. This is data-driven, so everything I'm sharing with you is not made up. It's like, this is what we know works. Fullen's work in leadership is powerful. The best thing, the skinny about finding the smallest number of high-leverage actions that unleash stunningly powerful consequences. It doesn't have to be anything glitzy and big. Mike Schmoker is, if you haven't read his work, and I can share some of that with you if you want, he writes about authentic literacy. I love his work, but I love this. If leaders, starting with district leadership, and this is where you will be so helpful, ensure that the schools pursue a reduced number of initiatives. So having you know this, you can just say, when anyone approaches you, because I know, you walk into a room, and someone's like, psst, 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 can I just talk to you about something? And they have a new program, or there's a salesman for something. Your answer can be, to be helpful, we have 3 priorities. How does this impact effective instruction, active reading and writing, or positive relationships? If they can't answer that question, move along. That's what we want to focus on. And so select the ones that are the most urgently needed and evidence-based. And we believe, and like I said, when Mike called me and talked about those, I'm like, that's what I believe in. So he made it harder to say no. And so these are 2 of the books where I would recommend to you. And they're also not deep, like it's not like you're reading a college textbook again. You've had enough of those. These are powerful reads if you're interested in that focus and leading with focus. So we know this. When we don't have sufficient oversight, we have success by chance. We got to get to success by design. That gets us out of the bullseye of DESI, which is where we are right now. That word partnership sounds a little too friendly. It isn't. It's about, you need to make some change, and you need to make it fast. So how do we get there? And this is what we did with the principals. I'm not going to go through this in detail with you, but I said to the principals, this is what we'll be looking for with you. And I introduced them to what I share with leadership teams all the time, which is 4 C's. A good leader, first of all, has to have clarity. In other words, be very clear about what your expectations are. Effective instruction, active reading and writing, positive relationships. That's clear. Everybody understands. There's nothing complicated. Then you have to be able to communicate that. So it's not just communicating to people, but how you, as a principal, facilitate communication among everybody. Then we need to be consistent about it. And I would suggest, and you probably saw it in the district review, this is probably our biggest weakness. There are pockets of shining stars around. There's no question. You read it in the review. You're like, in this teacher's classroom it was this, but in other ones, it wasn't that way. So consistency we need to get to. And then the last one is the most fun one. It's about the celebration of the success. We need to celebrate what's going on, appreciate the work of others. Everybody needs to know they're valued, and so that's powerful. So then I broke each one down a little bit more, and I'll move this along for you. How does the leader direct that clarity? Well, what they can't have is this, and I feel like you've probably been dealing with this as members of the school committee. You would just want to scream, right? It's like everything is coming at you. So, in fact, one veteran teacher in Brockton said this to me. She said, Sue, I used to know our focus. I was clear on what I needed my students to be able to do. Now I feel like I'm teaching from Pinterest. I find some great lessons and give it a go. That's success by chance. It's not really connected all together. So, do you think we're making a point here? Effective instruction, active reading and writing, positive relationships. Remember about when somebody talks to you about these are some things to remind them. First of all, those 3 areas are not just yet another thing. But they don't cost anything. It's nothing to be purchased. It's about good leadership and good work in the classroom. And now you've supported that work by supporting curriculum. I was telling the principals, when I was social studies department head, we didn't have a textbook that went past 1960. And because I'm old, I was filling in the blanks. Well, there was Vietnam, and then, it ended. It would just be, it was not supported. So, bravo. People have good materials now. So now it's about the instruction. This is not trendy. Some of the coolest tech programs ever, they look real slick, and then the next year it doesn't work anymore. I should have put this line with the principals, but a student, I was working in New York this past summer, and with a school system that's implementing a literacy initiative, and I was working with a group of kids, and this young man came over to me, and we were talking. I said, "Tell me what you're working on," and they were doing real pencil and paper stuff. And he said, "Miss, I want to tell you something. The technology stuff, that's good, but teachers are better for me." And that says it all. It really is. And by the way, I know there are turnaround plans everywhere in the school districts. There's so many schools in turnaround. These three goals, effective instruction, reading and writing, and positive relationships, are not in conflict with any of those plans. So if you hear teachers, well, we already have our plan. Well, let's talk about how effective instruction, reading and writing, and positive relations fit with those plans, because they should already be there. So these are the overarching goals that we'll operate by. They're research-based, they're supported by data. This work will be simple, but that doesn't mean it's easy. It won't be easy for you, it won't be easy for any of us. This is what I shared with the principals and so I don't know how much you have a chance to get into schools, but the kinds of things you should see, or when you're talking to kids, ask them about. The teachers should be making a very clear objective understood by the kids, have activities that engages the students, and then some kind of check for understanding. That's not complicated. Clear objective, engaging activities, some kind of check for understanding. By the way, we can share the PowerPoint with all of you. Mike sent it out to all the principals already too, so they have this as well. We're going to support the principals in all kinds of ways with walkthrough tools and help them, how do they strategize, because we're going to build a tool that will be based on those three focus areas. And for reading and writing, what does that mean? Literacy matters. By the way, when I showed this to the principals yesterday, almost every principal put their camera up and took a picture of this slide. And like I said, you can have the slide. But if anyone ever questions you about why this matters so much, these are powerful statistics. Take a look. 43% of adults with the lowest literacy skills are living in poverty. 50% of chronically underemployed, functionally illiterate. 70% of adults on public assistance, illiterate, are unable to read simple text. Welfare recipients stay on the welfare the longest with the lowest literacy skills. Prisoners, juvenile offenders. Literacy matters. Literacy is about equity and access. And this district is about equity, and it needs to be about equity, and every kid needs this. If they're not given access to it, and Mike said something about pushing the kids, and bravo, he's right. Like, the first time a kid struggles should not be when they're sitting for a high-stakes test. They should have been pushed by their teachers, and they should be saying, this is hard, I know this is hard, but you can do it, and I will help you. That's the message. If they struggle with it, that's okay. I gave the principals some look-fors in active reading and writing. And one thing to remember is, if you hear this line, let your ears go up and say, wait a minute. Literacy should not be an event, like, oh, it's Tuesday, my literacy day. No. It should be every day. It's deliberate practice. Writing is thinking. And then, of course, positive relationships are so important. They need to know how much the teachers care, and they do. And by the way, that was one of the shining things about the district review, of how much everybody cares. So then I went through communication. I'm going to skip through this because I don't want to spend all night, but I shared with the principals, here are ways to communicate with others. You have to talk the talk and walk the walk. And what does that mean? It means your community of people that you work with, parents, faculty, students, they need to know why. They need to know what the data say. They need to talk about it constantly in classes, visits, parent strategies, and always be following up. And so the more you can do that as well in the community, because you are all out in the community far more than us, so the more you can do that, the better. I always say this, and try this. When you are with principals and in schools, ask this question. It's a simple question, and it will be eye-opening for you. Ask the principal and then do it. If I went into the cafeteria and asked your students what was important to your principal or your teachers, what would the kids say? Let the principal answer that question. Then ask the kids. And that will give you a sense of how consistent the message is. So, and it's not a threatening one, you're just asking, so it's not meant to be threatening. But you have to make the focus clear, everybody knows it, but you can't just talk about it either. We're going to insist on targeted visits to classes so that teachers know that this is what we're focusing on and we can help you. It's always about support. Following up, and everybody needs to hear everybody talking about instructions. Some questions they can ask. And I told the principals a funny rumor that went around Brockton High was, we used to collect student work samples all the time. And so I would take some of them, a sampling of them. I didn't look at all of them. There's 4,000 kids here. But I would write some comments on some of the kids' papers, and so the teacher would give it back, and I'd sign it, Dr. Zach. And the rumor went around the school that I was reading all their essays, so it was like as if I could even, but that was a good rumor. It worked, so, you know, you never know. And then how they build communication among everybody, I'm not going to I won't spend time on that now, but I like this one a lot for you to ask about when you're in buildings. This is solid research. There's a lot of, much more than when I was here. There was very little time to collaborate among teachers in those days. There was very little. In fact, Brockton, the high school, the secondary level, at the time I was here, didn't even have professional days. So we were doing stuff in after-school meetings. Now you all have done a fabulous job giving people professional time to be able to collaborate. That said, it can't be just about teachers together in a room. Without a focus and without a mission, there's no evidence that will improve anything. So consistency, how do we do this? Effective instruction, active reading and writing, positive relationships. We're going to have a walkthrough tool that's based on those. So we model for the faculty what we're looking for. There's no surprises. We're not trying to gotcha. It's about helping everybody be ready for this. And partly this was based on a study that was done on us at Brockton High. Harvard did a study because we had closed the achievement gap. And the lesson, and this was the Achievement Gap Institute at Harvard. Ron Ferguson was the director, and what they wrote about us was the main lesson learned was that student achievement rose when leadership teams focused thoughtfully and relentlessly on improving the quality of instruction. And so that's what we will be trying to do. Active reading and writing all the time. Remember, it's not an event. If somebody says that to you, it's deliberate practice. And then finally, the positive relationships. That's powerful. Kids like to know their teachers care. And they like to have engaging conversations so that when you walk in the school, you know it's a place everybody wants to be. And finally, the celebration. And that's the story of success. We all want to feel valued and appreciated. And so we know that what we celebrate in our schools tells everybody what we value. So we're encouraging the principals and the teachers to invite us in, celebrate when there's been achievement, honor the kids that have made improvement. That's also important. We did videos about the school, social media, but a lot of you were in our school. So we want everybody to be the best storyteller because we want this city to be that city of champions. And my final message is this, and then we'll open it up to questions, and Mike may have some more to add. But one thing we know to be true is this. Leading for change that the principals and their teams need to do, it is not about brilliance. Leading for change takes tenacity, not brilliance. We need to do this with tenacity. We did it before. We can do it again now. I have no doubt about that because this is just an awesome team. So let me leave it at that, and if Mike has other things to add, we'd be happy to take any questions as well.
Thanks, Sue. So I don't know, Mayor, if you want to.
Yeah, no, I just want to thank Dr. Zakowitz, and I said this morning at the new teacher orientation. Dr. Zak was, without question, my favorite teacher of all time. And I don't just say high school, I'm talking college, law school, business school. What you see is what you get. So we're really thankful to have her back here. She loves Brockton, and she loves the students of Brockton Public Schools. So we're in good hands, but it is about tenacity. It's about working together. Everything up there, that's the mantra now, right? So now we as the leaders, the elected officials, need to effectuate the change with the principals, with Dr. Zak, and with our leader here, Mike Thomas. So kudos. Thank you for coming back from Florida. Thank you. Thank
I
you.
don't know if I'll be so happy in January, but I'm good now.
You know what? We'll come and scrape it for you. all
Oh,
right?
thank you very much. And may I add, Mr. Sullivan, that I am so proud of you and Mr. Thomas as former Brockton High students. Every time, first of all, I was so proud of how you handled COVID here, because I am living in Florida land, which has a different way of approaching it. And everything I saw you do, I was so proud of you. I admire it. And for Mike to be the superintendent, it just makes me feel so great. So thank you.
Thanks, Dr. Zak. Any questions? Mr. Minicello, please.
Dr. Zak, good to have you back. Just I guess some observations and concerns going forward that I think you need to be aware of. One of the major, I guess, observations that I have made is that over the years is that we really need to focus on who are our students, where do they come from, What do these students need in order to succeed? Effective instruction, absolutely. But how do we deliver that effective instruction when we have so many students from so many different places? When you look at our student body, you're going to be amazed how many different places these students come from. So perhaps there needs to be some sort of customization of delivery. I'm not sure, but what I'm saying is these are some of the things that go through my mind in order to give our kids that education they need, because we all agree that an effective Brockton High education, an effective Brockton Public Schools education at all levels is basically the economic equalizer for these children and these students to succeed later on. We have kids that are going to all sorts of great places, but we have a number of students that need to be brought up and, like you said, close that achievement gap. They need to be able to have the tools they need to succeed, like some of our top students that are going to phenomenal places and going to be phenomenal, successful adults, you know, and really help themselves and their families and live a really good life based in the fundamental basics that they learned here in Brockton. And we know that. But that really is something that I think needs to be paid attention to. Who are our kids? And how do we deliver effective instruction? And the other thing I've noticed along the way here in my career as a school committee person is, and it's something you said a long time ago when you were here, I can still hear you, that, you know, when the students get to the high school, you have pockets of students that are coming from different middle schools, different junior highs, different places, and they're not all prepared the same way. So someone, and I'm hoping it's going to be you, you know, as the deputy, needs to see, you know, is there uniformity? Is there consistency? Consistency. I mean, you have to. Someone really has to identify where are these kids coming from, externally, and internally in the system, and where are the deficiencies that need to be addressed. You know, I mean, you know, I've been for 14 years. I've been saying a middle school education in Brockton, from east, from west, from Plouffe, from Davis, is different. You're not getting the same student at Brockton High. So what I'm saying, and what I've been saying for years, is that someone needs to focus on you know, and maybe it's even below that at the elementaries, to make sure that when they get to the middle school level, they're all at the same place. But when you get them here at the high school, I think you have to admit, if you're going to be honest, that depending on where they're coming from, which schools in the city, you know, some kids are better at this or better at that. We really need to share our best practices, our method of delivery uniformly. You know, it seems like people want to obviously pat themselves on the back and say, you know, I'm doing it great here in my school. Well, that success or that effective instruction needs to be shared, for God's sakes. You know, I get people have egos, but we need uniformity in order to succeed. And until that's done, Dr. Zach, when these kids get at the high school, you witnessed it firsthand years ago when you were here as the principal. I can hear you in my back of my ear. You know, we need to put some of these kids in sort of remedial programs because they haven't gotten what they need. And I bet you could identify where they're coming from and say a lot of them are coming from here, there, and here. I mean, yeah, I don't want to call people out, but I'm just saying you have to do the hard internal work to say. That's a huge factor in this district.
You just hit on I think, Mr. Minicello, what you hit on is the most important C about consistency.
Yeah.
It has to be, we all are consistent. Because otherwise it is success by chance.
Yeah, exactly. Depending on which school and which, like you said, which teachers, but at least there needs to be that uniformity in each school, that the delivery Delivery is going to be, like you said, who the teacher is going to matter, but the teachers need to have the tools to deliver the goods in a uniform and consistent way so that when you go through the ranks, elementary, middle school, finally at the high school, it's more even. It's not over here is this, and like the graph is going, oh, east is this way and west is over here, and they're much better at math, but these kids are much better at science, and these kids are better at English. There needs to be some sort of harmony. I mean, of course, you're going to have some schools that are a little better at this and that, but that's been my concern for 14 years, and I've gotten very little success with my ranting over the years about this, and someone needs to come in and finally get the job done here, you know? I mean, school committee can only do what school committee can do. I mean, and again, COVID has made it tough for us. You know, you said, have you gotten into the classrooms? Well, last year we really weren't in the classrooms because there weren't classrooms. But I'm glad that you're here to do what needs to be done. But there needs to be an analysis of the system and the delivery and the consistency and the uniformity. So when kids get to Brockton High, the principal at Brockton High can say, hey, yeah, there's going to be little variations, but it's not going to be, it's going to be sort of a smaller difference, so to speak. And just getting back to that district review, we did go through some horrible years financially. So we did have restraints on us in terms of being able to invest in the best curriculum models, new technology. And this school committee and the administration prior to this administration, and certainly Superintendent Thomas, we finally have the money, the tools to do what needs to be done, and we have to do it, because now you can't complain and whine and say, oh, we can't do this because we don't have the money. Well, guess what? You've got the dough. Now it's put up or shut up, and now's the time. Because we were basically just trying to make the boat float. And we were doing a tightrope, a balance. Some of the experts were saying, well, you got to do away with all the activities, do away with all the sports, do away with all the extras. Well, if we ripped those apart and took them away from our kids who can't afford to pay, like other communities, a lot of kids are going to drop out because they're going to not be able to play instruments, do band, do sports, do this or that. So we were in a tough spot. It's like, okay, yeah, rip away all the goodies, but who's going to show up? We weren't sure, and we needed the kids involved in some good, productive, safe activities after school, because if they weren't involved, we all know where they're going to go. The streets are going to raise them, not the schools and the parents and the families. That's who's going to raise them, and that's what we didn't want. So they pointed the finger at us. They're like, well, you didn't look at the data and make decisions based on data. Oh yeah, we did, but we didn't have the money. We had to rob Peter to pay Paul to make this boat float somehow with some balance for kids and activities and keeping people safe and keeping the high school and the faculty safe, meaning that you have to have so many bodies to keep things safe in a school like this or in the whole district. So yeah, they would have liked us to do X, Y, and Z, but in order for us to maintain somewhat of a normal education and all of the extras that go along with that other communities and that certainly are wealthy and have money, whose parents have no problem writing out checks, to play football or to play baseball, or give them the bus or do this or that. That's not our community, and we weren't, as a committee, about to make winners and losers out of people that had money, in this community. So we tried to do our best, but I digress now. But there's some tough work, but the district really has to focus on uniformity and really focus on who our kids are, what they need, where they're coming from, how best to deliver to kids that are coming from certain, I can anticipate more children from Haiti, right? With the horrible things that are continuing to happen to Haiti. Those poor Haitian people, what is going on with these poor people in Haiti? But these children are going to learn at different levels. They're going to need different resources to make them have, like you said, effective learning. And it's going to require, I think, some customization and uniformity. So thank you for stepping up to the plate. But that's kind of a ramble, but it gives you an idea of what I've observed for 14 years and what needs to continue to, I guess, in order to get us where we need to be. There's going to be some hard work and some self-reflection and analysis on how we deliver and making us more even and work as a team, as opposed to people patting themselves on the back saying, wow, I'm doing so good at this. Well, share what you're doing with your colleagues so that we're all going to bring it up, and everyone will give you the pat on the back, but you'll be patting your back saying, look, it's not just my school. What I'm doing is affecting North, South, East, West, Davis, this one, Plouffe, whatever. I mean,
One of the things we talked about with the principals was how in their meetings, I'm glad you said that, because we're gonna call upon them to share best practice strategies with each other that we have seen around those priorities. So I agree with you on that.
we have a lot of talented people in this district,
right.
but we need to share their talents with everyone so that
Yes.
who benefits? The kids. The kids will benefit, and the kids will be successful. That's what it's all about, making these children successful. It doesn't matter who they are, where they come from, the color of their skin. They're all kids. They all want to learn. They all want to do well, and we all want to give them the tools. And the tools might be a little bit different for this pocket of people from a different area or this culture or whatever. I mean, so.
Thank you, Mr. Minichiello. Thank you very much.
Thank you.
Mr. D'Agostino, please.
Well, first, I just want to welcome you back. I have been hearing about you for a very long time, so it's good to finally get to meet you, the legend. No, and I appreciate a lot of what you said up there, and at the slide you put up about literacy and as it relates to poverty, it only makes sense. I mean, and we're not talking about, we're talking about basic levels of literacy to function. We're talking about, I appreciate that. We're not talking about, a medical degree or going to be a lawyer and the level of education. I mean, this is to even, if you don't have this level of K-12 level of literacy, forget the rest of that. It's not even a conversation. So what we do here is so important. I just thought that was a really powerful slide. I think we all already know that, that education is the great equalizer for sure, right?
Equity and access.
Right, and so if you don't have a solid K-12 education, that goes with you, So, and on the consistency in the middle school level too, the thing I would add to what Mr. Minichiello said, the other thing is, if a kid moves within the district,
Oh, I know, yeah.
so I'm at 6th grade at West and I move to, and now I'm at the Plouffe for 6th grade and I'm doing something completely different. We don't, that doesn't work
Or
either.
you do it twice.
Or I do it twice, right? So that's certainly something that needs to be addressed. But I don't want to go on. I just wanted to throw those few comments in. I appreciate and I look forward to getting the slide presentation.
We will get you that, yeah, and you can pull up, you can pull the slides up, so you've done it.
Awesome, that would be great. And I will share with you some feedback I heard from a principal or two, was that they felt that it was a very supportive presentation, that the approach was very supportive. And so I thought that I would share that with you and the superintendent, that was some feedback I had heard when I said, hey, how'd it go? And, oh, it was very supportive. And so
Well, that's what we hope.
right, that message came through,
I
at least
appreciate you saying that.
at least to the people I hear from.
You know how sometimes you think you're presenting one way, but then, so we appreciate knowing that, thank you.
Right, all right. I mean, it was no nonsense, but supportive at the same time.
I would say that's
Yeah,
true.
yeah, but that's fair, and that's what we
Would
need.
that be true, Mr. Sullivan?
Yes.
But that's what we need, because that's where we are. That's
what we need to do.
We need no nonsense and also being supportive, and that was the way it seemed to
Thank you so much. I
come
appreciate
across. So I'm excited that you're here, and I'm glad that, I have to say, just shortly before the pandemic, we saw our results. And I remember in the meetings, it was, now don't panic. And I'm sitting here and I said, I'm kind of starting to panic a little bit here. What do you mean don't panic? And then COVID hit and it was all about COVID.
You had to deal with that.
Right. So I'm glad now we're back in a position where, okay, yeah, that's still a problem. And in fact, COVID made it worse. But there's a plan formulating. And so that also makes me feel better that we're formulating a plan, because I didn't forget where we were. So, but at any rate, I look forward to, everything you're here to do, and whatever you need from me as a school committee member and as the vice chair, you let me know, and I'm all in.
Thank you so much.
Thank you.
Thank you, Mr. D'Agostino. Ms. Azak, please.
Thank you. Welcome back, Dr. Zach. So actually, Mr. Minicello and Mr. D'Agostino had actually asked some of the questions that I was, comments and things like that. And I do remember on numerous occasions, especially during the retreat, we would see certain schools excel. And we're like, why can't they show why they're excelling to the other schools? We need to be uniform. So I am excited. Class of 91, red building, BHS, class of 90. So we do have some alumni on here. So we are passionate about our schools, and this is why we're serving. But I just wanted to welcome you back. And years later, all you ever hear is, well, Dr. Zach and Dr. Zach and Dr. Zach. So that is a compliment. You obviously you did something right, and let's put us back on that map in a positive way. And we have 11 schools. And hopefully next time, within a short time, that number is going to get less and less. So we just want to welcome you back tonight.
Thank you, Ms. Azak. Any other questions for Dr. Zach? Mr. Sullivan, please.
Yeah, Dr. Zach, just wanted to welcome you back. I'll be real brief. I know it's been a little long today. I know it's not going to be easy. You have a big challenge in front of you to bring this whole thing back into perspective, and I wish you all the luck. And welcome back. Thank you.
Thank you. Thank you, Ms. Sullivan. Any other questions? We'll move on. Again, thank you, Dr. Zachowitz. Mr. Superintendent, please.
Next, we'll give a quick update from Dr. Cobbs on our new transportation department that's ready to roll well, I hope it's ready to roll. No, I'm just kidding. It is. I hope. Wait a minute. No, I'm just kidding. It's not funny. Are they all? I think they all start at least. No, I'm just kidding. So no, it's actually I want to thank Dr. Cobbs, Aldo, and the transportation team of our new staff in the transportation department. I know, and I want to thank HR because on top of hiring all the teachers and support staff over the last several months. They have been really scrambling over the last 3 weeks, hiring van and bus drivers, and it's been, mad rush. So I'll let Dr. Cobbs give an update on that, but I want to thank him and his team and all the work they've put in to get this ready. It's been a monumental task, but we will be ready to go next week.
Yes, Superintendent Thomas, we're ready. School committee, we do have a transportation department. We're up and running, we're ready. We've hired all the transportation staff, a new director, transportation supervisor, a dispatcher, a safety training coordinator, a administrative assistant. As of today, we've hired 52 drivers. We have 54 buses that will be running of our own, so we're just about there. We conducted a training on Monday, orientation for the drivers. All of our buses have been inspected by the state and the federal government. They're ready to roll. So we're up and running, and we have a transportation department. So our bus drivers are hired. Most of them are finished. They're completely finished with vetting with their COREs, their SOREs, their fingerprinting. So they'll be ready to start on September 2nd. It'll be ongoing driver training and orientation, so that's what we're doing. The office, right now, our transportation office is temporarily located in the central office, where the special education department used to be. We're in the process of outfitting the new office space for them over at the fairground, so we expect that to be ready, kind of on an accelerated schedule, probably within a month. So we plan to be moving them probably mid-October, hopefully. So we move them out of the central office. We have 3 garage spaces over at the fairground that will fit buses that we can repair. We're fine with that, so that's ready to go as well. So we plan to move the buses out of the school parking lot before the school starts. So hopefully either this week or next week we'll get them over across. We just about finished all the inspections. One bus had a problem. We had to send back to the manufacturer for some repairs, but that shouldn't be a problem. One of the large buses. Next week, we'll be conducting the training for the Zonar systems, and right now, we're doing the ongoing training for all the camera systems and integrating that into our radio system. So we're up, ready, and we're ready to go, and we have a transportation department.
Ms. Azak, please. Thank you, Dr. Cobbs, that was great.
Thank you, Dr. Cobbs. I just have a quick question. So it's definitely surreal pulling into BHS and seeing those buses. I know it's not the first time, so this has been a long time coming. Have we done like a practice run since this is our company now?
Right.
Have we sent out the bus drivers?
Yes, we have started some of the route trading for them. The routes are all established, through Peggy Kalea. She's done a great job working with the transportation department. The routes are established, so now we're doing the practice runs. Understanding that most of the drivers have been running the routes. They've been working for First Students, and now they work for us. So they live in the city, they're familiar with the routes. So the routes don't change a lot anyway. We're just doing them with our own buses right now.
No, perfect. Yeah, they just, that gets some of the kinks out of the first
Sure.
couple of weeks of school. As long as the bus drivers have done the runs,
Right.
they know where the stops are. And I
Exactly.
just, again, this is our company now. This is part of
Exactly
BPS,
right.
so we can control it. And so
The
that's,
only difference is we have to run our own buses to get them. We have to drive them so many hours. And so that'll be going ongoing too.
no, definitely. Because I know a lot of parents, and I'm sure Superintendent, that's like the biggest thing for the first couple of weeks until the bus stops. Everybody gets familiar with the bus stops and the exact times. But again, if the superintendent can chime in, you have locators on those buses, so we know where they are.
Absolutely.
Things happen, accidents happen, detours happen, but just so the families can rest assured, and they'll have a number to call if for some reason the buses are running late, something happens, there is like a quick contact number that they can.
Yeah, so
reach
I met them 2 weeks ago. I met with the transportation department, and I was clear on my expectations. And one of the big ones is nothing bothers me more than when a parent's calling a number and they can't get anybody to tell them where their child is and where their child's bus or van is. I just really cannot stand that. So we have a system in place. Jess has been working with them. I've made it clear that there always has to be a number. They can't get busy signals, and they have to talk to a live person, and that's going to know exactly where the van or bus is. So parents always have that communication. It will be for the schools as well, because a lot of parents will just call the number they know, which is the school. So we're going to, Dr. Cobbs is going to activate our radio system, which works really well. Tobias Cowens, we did not only with our own transportation company, we actually have Tobias, and Dr. Cobbs did this, we put him over at First Student with the live radio. So we have the radio system now that principals can talk to across the city, and they don't need the telephone. So they can actually radio, if it's a First Student bus, to Tobias and find out where a bus is from First Student, and they can get that information to the parent right away. But in-house, our own transportation will have the same capability. So no parent should be calling and getting a busy signal or getting somebody that comes on the phone and says, I don't know where they are. They could be there in 10 minutes. It's just not going to happen. And if it does, it's going to be fixed. It just cannot happen. And that expectation is made clear to the transportation department. Jess has spent a lot of time working on them. There's plenty of phone numbers that are active. We have the tools in place. The radio systems are in place. So we should always know where those buses and vans are and be able to communicate that to parents.
Is there an app of some sorts where they can track the bus?
Yeah, we're working on that
Okay.
one. Yeah,
I think that would
because
be
so many of
awesome.
them that don't work well. So once we get the Zonar in place, and I know Jess, I think with our new, is it Clever now, what they call School Messenger? I don't know. It changes every time. Every week there's a new name for it. So our communication system is called what now? School Messenger, but didn't it go to something, somebody else was buying it out? So I think School Messenger actually has a bus app section of it, so we're looking into that. If they don't have one that's decent, we'll find one that's easy for parents to be able to download on
I think
their
that
phone.
that would definitely be very helpful.
Absolutely.
Where they can just track the bus, so they know if the bus is running late, or,
Yep.
if they're running late, they know how much time they have before the bus gets there. But no, again, congratulations. This is going to be definitely definitely a historical day when our buses get out there the first day of school. So thank you for all your hard work, Mr. Cobbs, and your
Welcome.
team.
Well, congratulations to you all. You approved this, and you've been right there with Aldo and I from conception to realization. So, here we go. We're ready to launch.
Yeah.
Mr. D'Agostino, thank you, Ms. Azak. Mr. D'Agostino, please.
Well, first, thank you, Dr. Cobbs. Your work on this from when we finally said, yep, we're doing this, to getting us to ready to roll has been excellent. And I know it's been hard work and a lot of work, but you have done a great job.
Thank you.
Everybody involved has done a great job.
It's a great team, and the transportation team we have is second to none. They're the best in the industry.
Right.
We're going to be a first-class regional transportation outfit. Absolutely.
Right, and I have to say, I think this started. Was it the 2019 or 2018 school committee conference? I don't remember which year, but it was.
November of 2019, we
19.
were at the Mass Conference,
Yes.
and we had been talking about the busing for years.
Right.
I know it was years, I'm sure they've talked about it before we came on the
Yeah.
school committee,
But
but
it
once we
was-
saw what we paid what we paid to lease them, it just did not make sense why we didn't own them. So we were, we kept going at Mr. Petronio, go, why don't we own our own buses? But we just never had the funds. So in
Well-
2019, we made it happen. And it was a fluke the way that they were able to come out and
Do an evaluation.
they did an evaluation right before everything shut down for COVID. They were
Yeah.
complete with their evaluation.
Well, and that's the point I was trying to make is, I wanted to thank the superintendent and Joyce. And, we sat in that room with all these other districts from across the state and hearing the same thing. It goes up and up and up and up. The cost is out of control. Then a company you have gets sold to another company. You don't even know who the heck you're doing business with anymore. And, we were dealing with that same thing. It's always a one bid contract. Every district around the state that was in that room, one bid. Nobody else ever bids, so there's no competition. So you're stuck with who you have. And I think that it made perfect sense to finally look and say, hey, maybe the second bidder needs to be us. And there's a lot of. And I think being the size district that we are, like a smaller district probably couldn't do this, but the size city that we are, the size district we are, this is taking advantage of our economies of scale, right? And we do that a lot in the city. There's a lot of things we are able to do just based on our numbers and our size. But I did want to thank the mayor for supporting this, and Aldo and Troy, and and obviously the superintendent, and Dr. Cobbs and the team, and just everybody. There was a lot of moving parts to get to this point, but we're here, and I think that the city's going to save money, which is huge. And this is a city council side, or mayor side, I guess, of the budget expense. This isn't a school expense, so that comes out of that side, saves the city money, which I think is really important for the taxpayers and the voters to see that we're.
It's going to be a $4 million savings,
Yeah,
significant money.
It's big money, and we're actively looking for ways to save the taxpayers' money, and this was a big win. It was also a win from a perspective of being, and I think we learned this during the pandemic, that we needed to be the captains of our own destiny, for lack of a better way to put it. This also puts us in control of a very essential service. If we can't get kids to school, forget it. So this is such an important service for us to be in control of. And I, again, there's so many reasons it makes sense, but I just wanted to, thank everybody who was involved, from the idea of, hey, could we do this on our own, to here we are. There were a lot of people involved in that. Thank you.
Thanks, Mr. D'Agostino. Any other questions? Mr. Minicello, please.
And let's not forget that this was also because the school committee and the mayor, as the chair, made the right fiscal decision, and that was to not basically just pay for services we weren't receiving, because many communities decided to just continue to pay for services that weren't being delivered. So we were able to save money, make the right fiscal management decisions in order to have the wherewithal in order to, A, do this, and B, also purchase one-to-one devices, the technology that these kids needed last year. So I applaud my fellow colleagues on the school committee for doing the right thing and standing up for the taxpayers of Brockton, and basically making the right decisions fiscally with the taxpayers' money so that we can invest and now save, like you said, Mr. Mayor, $4 million, because we were every single contract at the mercy of one company. No one else would bid. We couldn't even divide up the district and have two companies sort of split the district. No one was interested. It was only one company who basically year after year after year after year went up, went up, went up, went up, went up, and up, and basically priced themselves out. And now, we basically have control and will provide our students in the city with more services at all levels of the day. The after-school programs, the field trips, the sports programs. These students are going to get more, and the taxpayer is going to pay less. The right decision at the right time, the right fiscal choice by this body. And thank you, Mr. Mayor, for supporting it, and also thanks to the City Council, because they supported it too. Because without their assistance, this would not have happened. We needed their cooperation as well, and they saw the savings that we saw. So, Mr. Thomas, thank you, Mr. Cobbs, and also Mr. Petronio. He was very helpful in bringing this about. So.
We also have to thank our friends in the county that reimbursed us $1 million for the one-to-one school district computers under the CARES Act fund. So that was a win-win for everybody. I just want to give a shout out to Dr. Cobbs. A lot of you don't know this. I have a mandatory department head meeting every Wednesday at 9 a.m. Jim's always there, and he's always giving all the department heads at City Hall all the most latest and greatest information. I want to thank you. And another example is we had a major water main break right outside here at Brockton High, right? Shut down the water here. Dr. Cobbs, Jamie Domestico, the brave men and women of DPW, they worked over 30 hours to get that thing fixed. The pipe was from 1968. So thank you for what you do every day, Dr. Cobbs. Appreciate
Welcome
it.
here.
Any other questions for Dr. Cobbs? I'm sorry, Mr. Rodriguez, please.
Just want to applaud you, Dr. Cobbs, you and your team for putting this together and all the hard work. And hopefully you could be a role model to the MBTA and they could look at your services.
Thank you.
Got that right.
Thank you.
Yeah, just think if you were in the MBTA, you could have retired 20 years ago.
Yeah, tell me about it.
Any other questions? Seeing none, thank you again,
Thank
Dr.
you.
Cobbs. Have a good night. Thank you. We'll continue, Mr. Superintendent.
Next, we have just a quick update. As you know, I sent you a message. I had a cap the registration for the virtual school at 400. Just less than a week and a half ago, we were only at about 150. And then when the Delta variant started to spread and our numbers were starting, Brockton went into the red, we had a large influx of people applying to go to the virtual school. And, I think it would have been, at this point, if we didn't cap it yesterday at the 400, we would be at close to 700. And the problem is we can't staff it that fast. You just can't continue to staff the virtual school that fast. So we had to put the brakes on and stop it at 400. So we continue to make sure we staff it, because it's not only about staffing it to making sure all the kids have what they need as far as especially their specialized classes, but we also we are mandated by the Department of Education, no matter what student enrolls. If a student with disabilities, no matter what their IEP says, we have to service that IEP. English language learners, the services that they need, we are required to give them that. And that takes time to get staff to get put in those areas and give the kids what they need. That's mandated by the Department of Education. So we did have to pump the brakes with the registration. So we had a meeting today. We'll continue to meet about just, again, making sure staff's in place. But as we move forward and get the staffing under control, we'll consider, opening up the registration again. But, I just couldn't continue and not have enough staff to service the kids. And, people would not be very happy with that, obviously, if their child didn't have a teacher, just even though virtual. And you just can't make it everything. You just can't put everybody on an online program without a live teacher. We need teachers to teach live, and that's the great thing about what our teachers did throughout the pandemic, and that's how the virtual school was set up. So we needed to put the brakes on, and I apologize to parents for that, but, you know, it just, we could not staff it that quickly. Again, I predicted it would have been 600-700 by at least Monday, and it's just, it's so hard to find teachers that fast. So that's where we are with the virtual school.
Thank you. Any questions from Ms. Superintendent? Ms. Azak,
Just a quick
please.
question. So I know previously, we had always said if a student had gone in person, it was easier to go from in person to virtual. So for those that were not able to sign up for the virtual, I mean, once we're able to accommodate that, they still
Yeah.
have that option,
They would
even
have
when
the
school
option,
starts.
but once we have to see where our staffing is, it's not going to be immediately. We would have to, again, see, you know, we'd have to make sure we can service if they have an IEP, or if it's an English language learner, we have to make sure that we're able to service their plans. So it would take a little bit. And again, if people were to go to the virtual school, they have to commit for a semester, because it's just, you can't go back and forth. It's a school now. Before, when we were fully remote, a hybrid, you know, and teachers were live streaming from their classroom, the students were in their regular schools, and they could, you know, they could stay home and then come back, because they were just going, but now they're going to a separate, it's called the Brockton Virtual Academy, and they're students of that school. So once they commit to going, they need to stay for at least a semester. And, you know, but again, we hope to see where the staffing is over the next 2 to 4 weeks, and if we can reopen again the registration, we'll go from there. We've had a ton of calls from outside the system, trying to get their kids to come from other cities and towns, and we're not allowed to do that per the Department of Ed. So it's unfortunate, because we could have picked up some extra funding, but that's not allowed. We can only take students who are residents of Brockton.
Okay, so the transfer from in-person to virtual is a little shorter, it's faster than going from virtual to in-person?
No, it would be quicker to go from virtual to in-school.
Okay,
Yeah, it's going to be much harder to go from in-school to virtual, because it's the staffing.
okay,
Obviously, we're much better staffed for in-person learning, because that's what we're doing, and that's what a majority of our kids are doing. So if there is somebody that wanted to come out of virtual and now go to full in-person, they can do that much quicker.
okay.
It's going to be a longer process to go to virtual, it's just because we have to staff it the right way.
Thank you.
Any additional questions? Seeing none, we're going to move on. Are there any items referred to subcommittee? Mr. Vice Chairman, that you're aware of?
None that I'm aware of.
We will move on then. We'll go to agenda item 4, which is unfinished business. It's A and B. A, fogged up, I can't see a thing. Getting awful old, I'll tell you. All right, A is the review of bid review subcommittee meeting report, August 11, 2021, discussion and potential vote regarding bids on the following project. 1, FY 2022 new classroom wells installation at the Downey. Any comments on that? Any questions on that? Mr. Sullivan, was that before your subcommittee?
About the bid review meeting. Do you want me to read it off?
Sure, if you could, that'd be great, for the record, thank you.
It was Wednesday, August 11, 2021, at 5:30 PM. The meeting was called to order at 5:35. The bid review subcommittee meeting held on Zoom, meeting ID number 810-7512-9637, passcode 518066. Thomas was the presiding for BCA. Present was Chair Tim Sullivan, Mark D'Agostino, Judy Sullivan. Also present was Mike Vandis, BPS Administration. Roll call for quorum. We had the quorum. Governor Baker's open meeting law was read, with the exception on April 1st, 2021, was extended till April 1st, 2022. A regular roll call was done by Mr. Vandis. We had 100% in attendance. It was announced by the chair that this meeting was recorded. We had one bid before us for fiscal year 2022, bid number 2280-0013. new classroom walls and installation at the Downey School, 55 Electric Ave, to be done by Collins Construction of 33 Swindell Street, Fall River, Mass. 02723. It was the only bid and the low bid of $522,028. Motion was made to accept bid by Judy Sullivan, seconded by Mark D'Agostino. Roll call. The bid was approved 100% unanimous. Any other business to come before the subcommittee? There was none. Motion to adjourn by Judy Sullivan, seconded by Mark D'Agostino. A roll call and 100% in favor. Meeting was adjourned to 5:46. I would like to make a motion that we accept these minutes as presented.
There's a motion made. Is there a second to that motion?
Second.
There's a motion made by Mr. Sullivan, second by Mr. D'Agostino. Any questions on that motion? Mr. Rodriguez, please.
How extensive is this job? Are they like ripping the walls down? I mean,
No, so this is for the Downey. So Downey is all open pods. So there'll be building walls to separate the classrooms, the current classrooms, which are open air. We did this at the Davis and the Raymond, probably once they fixed the roofs, going back 8-9 years now. And we're doing it now at the Downey, which is long overdue. So we had to put a bid out to get the walls put up. And so this was the bid that was out for at least 30 days, I believe, right, Aldo? Had to be out for 30 days, and this was the company that we got.
Any follow-ups? No, you good, Mr. Rodriguez? Mr. D'Agostino, please.
Just a question, kind of piggybacking off of Mr. Rodriguez's question. So are there any other schools now? We did this with Davis. We're doing this at Downey, Raymond. Are there any other schools with these pods?
No,
that
this will
should
be it,
done?
thank God.
Okay,
Yeah,
that's great.
this is it. I think we have to finish, I think we were finishing, there's 2 pods at the Raymond left to do, which we'll do in-house. And I think there's 1 at the Davis left to do, which will be done in-house. The Downey is 7 pods or 6, Aldo? 6 pods, thank you, Dr. Cobb. So that's 6 pods. There's a lot of work there. And so, this is something that we wanted to get done. We were hoping to get it done earlier in the summer, but COVID has delayed everything, not only, getting people to bid, but, getting materials and everything in construction, as you know, has been delayed. So this will do it for the pod schools.
Great.
We are moving on from the 70s.
It only took us 50 years.
So any follow-ups on that? No. So we have a motion on the floor, but remember, it's relative to accepting the minutes as was stated, and then we'll have to entertain a motion relative to accepting the bid. All in favor, those properly second. All in favor of accepting the minutes? All opposed? That carries. Mr. Sullivan, you want to make another motion now relative to the bid itself?
Yes. The subcommittee moves this bid favorably to the full school. The subcommittee moves this bid favorably to the full school committee for its approval. Can I make that motion?
Form of a motion. Is there a second on that?
Second.
Second. It was made by Mr. Sullivan, second by Mr. Minicello. All in favor? All opposed? Carries unanimously. Thank you, Mr. Sullivan. We will now go on to subsection B relative to that. You have the floor.
This is.
That's
Oh, you?
accounts review.
Who was it?
Accounts review is me.
I'm sorry.
That's all right.
It's been a long day, man. Let's keep going.
All right, not a problem. This will be very brief. So on August 17th of 2021, the Accounts Review Subcommittee had a meeting. Present for the meeting was myself, Mrs. Mendez, Mr. Sullivan, and of course from Finance, Mr. Bandis. I called the meeting to order at 5:37 p.m. There was several items that had been sent to the Accounts Review Subcommittee. For those who don't know, typically in advance of a meeting, we will get documents sent to us with all of the payments that have been made by the district since our last Accounts Review Subcommittee. And so then we review those and ask any questions we have on those payments. There were several items that the members of the committee had questions on. Mr. Bandis provided us the information and documentation that was requested. We had some discussion. And then there was after all the discussion, a motion made by Mr. Sullivan to accept the accounts review vendor, or accounts review lists that have been presented. I won't go through and read them all, they are here in the record. The motion was seconded by Ms. Mendez, and a vote was taken unanimously. There was no further business, so we adjourned with a motion to adjourn by Mr. Sullivan, seconded by Ms. Mendez, and the meeting adjourned at 6:02, and that is my report of the Accounts Review Subcommittee.
Is there a motion to accept those?
Motion to accept.
Second.
Motion made by Mr. Minicello, probably second by Mr. Sullivan. All in favor? All opposed? That motion carries. New business, number 5.
I just have a quick one. I just want to thank Dr. Moran in the Human Resources Department for the new teacher orientation that they put on today. It started this morning. It was supposed to be, and also for their flexibility, it was supposed to be here at Brockton High School, and then with the water main break, it had to be switched over to the unknown. But when I walked in, I want to thank Mayor Sullivan for being there, Mr. Sullivan for being there. Kim Gibson was there, and I want to appreciate the hard work of the HR department. Looking across that cafeteria, Dr. Zach was with me. It's just to see 150 teachers and counselors and adjustment counselors. It was, yep. Just looking across, and I know how hard it's been for HR to just get everybody hired and making sure the background checks were done, and principals, how hard they were in all summer, recommending and hiring people, and doing their reference checks, and looking at just across the room at the new young faces. Some of them were not young faces; their career changes. But also, it reflected the real efforts of the school committee, the HR department, and the principals. For you saw the diversity and the efforts that have been going on to hire more staff of color. And I think a majority of the teachers that sat there today were from our para and MTA. We're paras and MTAs in the Brockton Public Schools, so the Grow Your Own program is working well. So I want to thank, again, HR. I want to thank all the work that's been done with our paras, our MTAs, and our real focus on diversity. So it was just great to see. It was great to see the new group and talk to them and welcome them to the Brockton Public Schools. And I was saying to the group today, when some years we would have been able to have that meeting in a closet. I could have had it in my conference room, because sometimes you were talking to 4 people, and that obviously reflects the poor budgets we've had over the years, where the only people we were hiring, if you really need to, because people retired or left us. But to be able to see 150 people, I can't even remember the last time. It hasn't been since probably when I was hired 9 years ago. So that's the first time I've seen that many people. So kudos to the HR department, and I want to thank everybody for coming today. It was a great morning. And it was not only a morning, it lasts the whole day, so it's a full day for HR. There's a lot that they do with the new teachers, so thank you.
Yeah, I mean, I also just want to say thanks to the BEA and leadership under Kim Gibson, Class 88 Brockton High. It was just awesome. When I walked in there, I literally expected, 24, 150 people, and they were ready to go, hit the ground running. It was awesome. So kudos to everybody. I wished him a long, healthy career. Now I'm going to take my mayor hat off. I'm going to put my dad hat on. I went to the 4th grade orientation today at D'Angelo, and I want to give a shout out to Principal John Kelly and his team there. It was exceptional. As a parent, it was awesome. And, the tag program, people get nervous, get confused, but there was true professionals there, really great illustrations. So I just want to thank Mr. Kelly and all the 4th grade teachers that were there as well. So I'll put my mayor hat back on now, so we'll get back at it. We do have to go into executive session tonight. I do have to do the legalese and read it into the record. I do want to make it clear we will be coming back into session tonight. So if I...
Sorry, Mayor, can I just make a quick
Oh, I'm
question?
sorry, sure,
It's okay,
sure,
it's
Ms.
okay.
Azak, sure.
It was a last minute, we tried to pull it together, so Cradles to Crayons has gone again and donated 2,000 backpacks, school supplies, so I do have a list of volunteers. I'll do that at another time. But we came together last week and we put together 1,000 supply bags, which is, it's a lot. It's a lot. We had probably about 15 people, maybe 20 people. So, and then a few of us grabbed them and we were able to head over to West Junior High West Middle and East Middle. So tomorrow, between 3 and 5, we will be there giving out backpacks. So it'll be tomorrow, Thursday, August 26th, between 3 and 5. So I do apologize, we weren't able to advertise it sooner. It's just between my schedule and trying to get volunteers. And we're still trying to stay safe with what's going on with COVID. But we did have a lot of families reach out, so we'll be doing that. We gave out, I believe, Mrs. Sullivan was volunteering, so she was a huge help. So we gave out, I believe, 300 last week, and tomorrow we're gonna do 300 or 400. So whatever we can give out, we're gonna try our best. And some of the schools have already gotten some of the backpacks, but if there's families out there, tomorrow, East Middle, between 3 and 5. And thank you to Cradles to Crayons, because our partnership with them, it's amazing. It's amazing, what they've done for us. So, all I can say is, we're very lucky to have them partnering with Brockton Public Schools. But thank you.
And we want to thank you too, Ms. Azak. You run point on that. It's not just the backpacks, it's clothing, it's winter clothes, it's school supplies. So kudos to you, Joyce. Thank you.
Thank you, I appreciate it. And then a quick message, so, thank you, because I remember a few years back, 100 and some odd yellow ribbons sat on empty chairs when we did our layoffs. So this is the first time in my 6 years that we've actually hired so many people, and hopefully we can give them stability. Hopefully we can give our BPS staff some stability. We've gone through some really tough budget cuts in the 6 years I've been on here, so definitely. So it's a positive note. We're starting on a positive, which is great. Thank you.
Thank you. Any other new business questions, Mr. D'Agostino?
Just a quick comment. Again, kind of piggybacking on what Ms. Asak said, what a contrast from the past several years. I can just imagine Convocation this year. It's going to be such a different vibe with all these new folks coming on and rebuilding the district, and the work that Dr. Zach is here to help us get going. Just complete 180 from some of the starts that we've had in the past. I mean, I remember just a few years ago, the Twitter feed set up behind the superintendent with teachers giving, positive, we got this, we can do, we'll support each other, right? Trying to, send that message of we can do this. And so it's a completely different ballgame now. But I would be remiss, since you started giggling over there, Superintendent Thomas, I'd be remiss if I didn't mention the best tweet of the whole thing from Deputy Superintendent Thomas to the superintendent at the time, Kathy Smith. Wrap it up.
We do have a baby grand now.
It popped right up behind her. It was great.
That's awesome. That's
Oh, I thought she was going to kill you.
That's fantastic.
That was the best.
Anything else? So I'm just going to read the following to the record, and then we have to entertain a motion to go into executive session. So the committee will enter executive session pursuant to Mass General Law, Chapter 30A, subsection 21A3, for the purpose of conducting strategy with respect to collective bargaining, as conducting this deliberation in an open session would have a detrimental effect on the bargaining position of the committee. The committee will return to open session following executive session. I need a motion on that, please. Motion made by Mr. Minicello. Who's the second? Second by Mr. Sullivan. All in favor? All opposed? We will go in, but we will be coming back.
We have to do a roll call.
Mr. Minicello?
Yes.
Ms. Rodriguez?
Yes.
Ms. Azak?
Yes.
Mr. Sullivan?
Yes.
Chair says yes. Thank you.
Thank you.
We hereby are back into full session. Thank you. We did just have an executive session. I do have to do a roll call vote to reestablish a quorum. Mrs. Sullivan?
Yeah.
Mr. D'Agostino?
Yes.
Mr. Minicello?
Yes.
Mr. Rodriguez?
Yes.
Ms. Azak?
Yes.
Mr. Sullivan?
Yes.
Chair says yes, we have a quorum. Entertain a motion. Mr. D'Agostino?
Yes, motion to approve the one-year contract as presented to the school committee between the Brockton School Committee and the Teamsters Local 753, representing the Brockton Public Schools custodians.
Form of a motion, is there a second?
Second.
A motion was made by Mr. D'Agostino, properly seconded by Mr. Sullivan. Any questions on the motion? Seeing none. Do you have a question?
If I could just make a comment.
Okay, sure.
I just want to thank all the members of the bargaining team on the school side as well as from the union. You know, we certainly started, you know, apart on at the beginning, and both sides were reasonable and worked together to, as we always do, get to a fair deal that was agreeable to everybody. There was things they gave and we had to give up, and things they got and we got. So it was, you know, again, as is generally the case when everybody gives and gets a little, you know, that's usually an indicator of a fair and reasonable deal. So I just wanted to thank everybody, again, you know, from HR that was involved in that as well, and, you know, our attorney, Sarah Spatafor, and, you know, for their work in getting this done. Thank you.
Thank you. So we had a motion, it was properly seconded. All in favor? Raise your hand. Thank you. All opposed, raise your hand. Motion carries unanimous. Now I entertain a motion to adjourn at this time.
Motion to adjourn.
Motion was made by Mr. Sullivan, properly seconded by Ms. Sullivan. All in favor? All opposed, motion carries. Have a good night. Drive careful.